And I'll make sure they gavel you.
There's these little
I'll make sure
cards
you
that
get
look
gaveled.
Order the Human Services meeting. If we could all stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. If we could have the clerk take the roll, please.
Commissioner Angie.
Present.
Commissioner Torello.
Present.
Commissioner Samasco.
Present.
Commissioner Felix.
Present.
Commissioner Rushing.
Here.
Commissioner Vandenbosch.
Here.
Commissioner Baden.
Present. Are there any changes, additions, or deletions to the agenda? Hearing none, I'll accept a motion to accept the agenda as presented.
So moved.
Support.
Thank you. Any discussion? All in favor?
Aye.
Any opposed? Motion carries. Citizens wishing to be heard this evening, I have Carol Miller on community mental health appointments.
Good evening, Commissioners. You guys all know me. I come quite often. I just wanted to say hello and that I did put in for the community mental health appointment for the board. As you know, I've been a nurse for 41 years. I have an impeccable license, and I've been a representative of numerous committees, and hopefully you will vote for me to be a representative of your county. Thank you.
Are there any other citizens wishing to be heard tonight on the matters of human services? Seeing none. Tonight we have an update from Deb Johnson of Community Mental Health. This is a result of our last workshop where there was some interest in learning more and getting an update on community mental health. So I did reach out to Deb and ask her to present to us what's happening with our mental health in our community. And I think it's a good time as we are looking at some reappointments. So I'll give the floor to you.
Okay. First of all, thank you for having me. I always like talking about community mental health. I'm very proud of our organization. We do a lot of great things. And often I get asked to talk about it, but I get 15 minutes like tonight. And it's very hard to talk about our agency. It's very large in 15 minutes. But we made a quick little video that we'll show now. Where is the IT guy?
He's in the IT room. Yeah.
Okay, so you can start the video. It's 3 minutes, and then I'll talk for 12. St. Clair County Community Mental Health is a leader in integrated behavioral health care. As part of the public mental health system, CMH has diligently worked for 60 years to provide opportunities for health, wellness, and connection. We currently have 5 locations throughout the county. We have 2 locations in Port Huron. On Electric Avenue, we serve primarily adults and their families. Oops, what happened? And just a mile down the road, we have our dedicated Child and Family Services building on 24th Street. To serve the people in the outlying parts of our county, we have 2 offices in Marine City and 1 in K-Pac.
Our services are available to all adults and children with mental health conditions, intellectual and developmental disabilities, and substance use disorders.
The Community Mental Health Act of 1963 was the foundation of the modern public behavioral health system that CMH is a part of today.
We are also a certified community behavioral health clinic. As a CCBHC, our comprehensive services ensure people have the access to the care they need, regardless of insurance status or ability to pay. Our focus on integrating behavioral health care with physical health care ensures that we are treating the whole person and that we are working to improve healthcare outcomes using evidence-based practices. As a result of our integrated healthcare approach, we have multiple community partners working collaboratively to provide comprehensive care for the people we serve. The People's Clinic for Better Health is located at our main office in Port Huron and provides primary care services. Genoa Pharmacy is also located and offers a convenient place to fill prescriptions. These partnerships are vital because they ensure that people can access the care they need under one roof.
If you are living with a mental health condition, an intellectual or developmental disability, seeking treatment for a substance use disorder, or are the caregiver of someone with any of these concerns, you can learn more about our programs and services, including how to access services, by calling the Access Center at 888-225-4447.
We know that the mental health conditions and substance use disorders don't always present during business hours. Mental health crises can occur at any time of the day, and our team is always here to help. Our mobile crisis unit is available by phone and in person to assist any adult or child in St. Clair County who is struggling with an immediate mental health crisis. Always just a phone call away, the MCU team can help you connect with resources and follow-up care, and most importantly, ensure that in a time of crisis, you have the support you need.
You can reach the mobile crisis unit 24 hours a day, 7 days a week, 365 days a year at 810-966-2575.
In addition to providing behavioral health and support services, we are committed to improving the health of our community by offering education, information, and resources to support building a strong, resilient, and recovery-focused community.
Our vision is to remain the leader in integrated behavioral health care by promoting our core values of compassion, accessibility, relationships, empowerment, and service excellence. For more information, visit our website at sccmh.org or connect with us on social media. Do I just start clicking? I don't know where that. Yoo-hoo. Help. Okay, okay, well, I passed the front thing, but the front was just a cover saying it was a presentation today for the commissioners. At any rate, one thing that is kind of exciting about this year is this is our 60th anniversary of being a community mental health agency in this county. You can see one of the little bullets down there, 1965, in response to Public Act 45, the St. Clair County Board of Commissioners at that time formed the Mental Health Board. And then there's other things through there, and I'm not going to go through them all. You guys all have a copy of our PowerPoint in there, and you can see some of the significant things over time. And also, we're going to expand on that timeline and add a lot more detail well, it'll be presented at our annual meeting, which is May 21st this year. You're all invited. Actually, the community is invited. Anybody who would like to be there. You can find information on our Facebook site or website. Okay. This is a little slow. I think he did tell me to be patient. That's not my strong suit, sorry. Okay, so you already heard a little bit about our mission, vision, and values. In 2023, we updated that. We got a lot of feedback from people in the community, people that we provide services to, family members, et cetera. And that is what we ended up with. And it's already been said in the video. I'm not going to repeat it. And then we created this other companion document to more fully explain why those values are our values. And so you can read that at your leisure. In 2023, we really revamped our strategic planning process, and we've always looked at other key community stakeholders, what are their strategic priorities, and then how does that relate to us and what should be our priorities as well. So our board agreed with us that our 4 priorities are organizational efficiency, and with that we mean that we need to make sure that we stay up with technology in terms of doing things, work smarter, not harder, things like that. We want to be effective and efficient in every way. And then there's a lot more detail to this. This is just the summary. Also education, and by education we mean to provide community education, even situations like tonight where I'm talking about community mental health. We want to spread the word because we want to make sure that people know how to access services when they need them. If you guys are familiar with the CHIP that the health department does, the Community Health Improvement Plan, we have been a partner with them when the assessment was happening, and then also with the plan development itself. And there's a couple of ones that we're addressing regularly, helping with them. One is access to mental health and substance use treatment, and the other is like wellness, obesity, different things like that. So I'm sure you'll hear more about that at some point. And then, so it's important to educate the community. Workforce development, we want to continue to make sure that we have a really strong and qualified workforce. And we also want to do that. We foster a relationship with schools, different places like that, to recruit like psychiatrists. We call it grew our own, because when mental health needs kind of skyrocketed after COVID, we did not have nearly enough mental health therapists, master's level clinicians, or even nurse practitioners, as we needed. And so we even a little bit before that, we started to offer people the opportunity to do their education with a commitment to continue working for us. And that has worked really well. In the meantime, the state has done a lot of incentivizing too of those kinds of career areas, because they know there's a shortage, not just in the state of Michigan, but nationally. Program excellence. We always strive to be leaders in the care that we provide. You'll hear a little bit more about that as I talk about our evidence-based practices and things like that. So we want to continue to always look at that and focus on social determinants of health and how they impact a person's overall well-being. Again, those are the 4 locations. That's just a map showing you again. And then I don't know if you all realize, but we're part of it's called the PIHP system. PIHP stands for Prepaid Inpatient Health Plan. And there are 10 of them in the state of Michigan. And it's a long story to tell you how we got there, but at one point, we were the PIHP. When I was first hired as the director, we were the PIHP, and we were overseeing Sanilac, Lapeer, and St. Clair. Then the state decided some PIHPs weren't big enough, ours included, and they said you need to add somebody and they have to be contiguous. So for us, the only option was Genesee County. They weren't happy about it, but they joined with us. So the colors are close together, but the darker brown towards the edge by St. Clair County, that's Region 10. So that's what our region is called, and this is basically what they do. So, oh, shoot, sorry. This clicker's different than our clicker. So Region 10 holds a contract with the Michigan Department of Health and Human Services for, as you can see, $350 million of Medicaid, and that is a capitated budget, meaning it doesn't increase based on the amount of services you provide. It's based on the number of people with Medicaid in each community. It's called the per member per month amount of money. And so you can see out of that $350 million, St. Clair gets about $104 million. You can see the other allocations. There's also some PA2 dollars, but I'm not going to talk about that today, for substance use services. So Region 10's job is to monitor and make sure we provide services in accordance with Medicaid guidelines. And so we have a contract with them for the Medicaid services. But we have a lot of people that don't have Medicaid. They have no insurance or they have other insurance. For those people, we have a general fund contract with the state of Michigan. And it's basically the same as the other one, but the Medicaid part is removed, but the requirements are all the same. We currently have 474 employees in 5 locations. You saw the budget. We have about 205 contracted providers. I'll tell you a little bit more about that in a minute. And about half of that budget goes to the contract system. The past fiscal year, we served over 7,000 people. And that was an 11% increase from the year before. And each year, we've been trending upward, 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 not only with the number of people we're serving, and then, of course, we have to hire more people to keep up with all of that. And I just want to reference, you have a lot of things in your packet, but one of the things is SCC at a glance. And you would see up in this corner here, total number served. It has that 7,082. It shows you what population they make up, like adults with mental illness, adults with intellectual developmental disabilities, children, et cetera. And so you can see that. There's a lot of other quick hitter good statistics, I think. And we are currently expecting, if our projections go as we think they will, at least an additional 500 or 600 people this year. So that's what we're on track for right now. Could be more, could be a little less. In terms of eligibility, we talked a little bit about that in the video, but basically if a person thinks they need services, they can call 888-225-4447, and that access center is managed by Region 10. That is not our staff. So if you call there and you don't get what you need, you call me, please, because I will still help out because I can intervene with Region 10, but it's not our staff that do that. So they look at some, the presenting problems, the issues, insurance types, things like that. And then they decide if the person's eligible for services. And since we became what's called the Certified Community Behavioral Health Clinic, almost the majority of people that present for services are eligible. So it expanded service opportunity or eligibility or access for people with private insurance, people with mild to moderate mental health conditions, and people with just substance use disorder. Before we became the CCBHC, we could only serve a person with a substance use disorder if they had a co-occurring mental illness, but that's changed now. So we're providing those kinds of services as well. Okay, I actually just said all that stuff basically. The only thing that the CCBHC didn't expand services for is people with intellectual or developmental disabilities. They're not included in the CCBHC. I don't know why I didn't write that bill, but that bill is under the Excellence in Mental Health Act that was presented to Congress from Senator Debbie Stabenow and co-sponsored by Senator Roy Blunt from another state. And it was a bipartisan supported initiative. The other thing, we call it rapid crisis response, but we have a mobile crisis unit in this community that anybody in St. Clair County, if they think they're in mental health crisis, or their son, daughter, husband, whoever, friend, they can call that number anytime, 24/7. It will be answered by a person, and that person does work for us. And you can tell them what's going on, and they will decide if they need to come out and do a face-to-face screening with the person. They might say, based on what you're saying to them, you need to take them right to Port Huron Hospital because they probably need an inpatient admission, or you need to call the police, or there's all kinds of different things that happen. Also, our mobile crisis team has gone out with the sheriff and Port Huron Police, any of the law enforcement, if they think that it is going to be a mental health issue. In fact, Sheriff Matt King went with us a number of years ago to advocate in Washington for additional CCBHC funding. And they do listen to law enforcement more than the mental health professionals. I don't know why. But anyways, it was, so we did get that funding. The other thing I like to say about that too is if you're not sure, some people are like, oh, maybe I shouldn't call because maybe it's not really an emergency. Don't hesitate, just pick the phone up and call. Our staff can help you decide if it's an emergency because we'd rather be safe than sorry. And I'm sure everyone else would be too. This is our direct operated system. We have an administration and a support services team. We have a lot of data reporting requirements with the state of Michigan, a lot of billing with insurances and things like that. And so we have to do a lot of training, all kinds of things. And so we have facility management. We currently own 22 facilities. That includes group homes and buildings. And so we have people that help manage all those things. We have an IT department, all those things. That supports our services and our operations. And you can see adult and family services. I'm not going to go through all those services. And there's children's services. And in your folders, you have the pamphlets on all those services. And you also have a really nice program guide booklet that describes all of them as well. Oops. The contract system that I was talking about, I'm sure a lot of you have heard of a professional counseling center, for example. May or may not have heard of New Oakland Family Center. That's newer to our community. They took over the Advia building on 10th Street. Those are outpatient counseling centers, and we contract with them to provide, then they provide a lot of the services too. We also contract with other organizations that provide services for kids with, or people with autism. We also have just a lot of community living type support services provided by a number of agencies in the middle there. We have 3 residential providers, Blue Water Developmental Housing, Impact, and Innovative Housing. And between the 3 organizations, they operate about 30 group homes. Each group home serves 6 people at a time. And then the inpatient contracts, it looks like there's a zillion of them, and there are, because sometimes some we have set contracts with, but other ones that you might not recognize. If a person is not in our county and they need to be hospitalized, they get authorized by us or Region 10, and then we have to do what's called the single-use agreement with them to pay for their care. So there's a lot of those. Oh, and I don't know if I said it before, but we have currently about almost 500 employees, and then the contract system has about 1,200 employees. So with our funding, that's the number of employees in this community. These are just a lot of the different services, psychiatric care, including prescribing medications. We have a lot of individual and group therapy. We have classes. We're doing a lot with integrated care because we know that it's important to treat the whole person, not just their mental health issues, but their physical health issues, because one can impact the other. I mentioned before, we always want to kind of be at the top of our game with the services that we do provide. We currently provide 21 evidence-based practices, and they're all listed there. We also have 7 promising practices. That means they kind of started that process to be certified or credentialed as evidence-based, but they didn't do it all the way, and maybe they're not going to. But we have a lot of really great programs. And again, I was mentioning classes already. We have a lot of classes that teach life skills, how to take care of yourself better, wellness classes, the importance of integrated treatment, a number of support groups, and creative art classes. I already kind of talked about integrated healthcare, so I won't again, but we do have, not only the People's Clinic moved into our building, actually shortly after we built the building. And so they're there providing primary health care to people with no insurance or Medicaid, and then they can be Medicaid, Medicare. And we also have agreements with Communities First Health Centers of Michigan, and to do physical health care. And then we also try to get coordination of care agreements with all local providers. So if you tell me your doctor is, I don't know, Dr. Smith, then, and you want us to work together with Dr. Smith on your care, you sign the coordination of care, we send it to them, they sign it, and we can share information. We do a lot of community benefits. We currently have a veterans walking group. We have a lot of other support groups. We have a lot of educational opportunities. We have speakers that will talk on a wide range of topics. I already talked about the community, the crisis intervention services for our community. And then we also do a lot of volunteer things throughout the county. Community partners are important to us, and we have really good collaborative relationships with a lot of community partners, including law enforcement. In fact, in the city of Port Huron, we have a clinician, a master's level clinician that we pay for, and she's in their building. So she goes out with them on all domestic calls. They think it's great. In fact, so great they've asked for a second one. So we're in the process of figuring out how to do that. But that's been a big bonus for them, they said. We also do a lot of training with St. Clair County Sheriff's Department on a regular basis, and especially mental health first aid and just different things like that, so they know to help them intervene as appropriately as possible with people with mental health issues. And we play a key role with the St. Clair County Community Services, Services Coordinating Body. And we added to your packet. This is the 40th anniversary of the Community Service Coordinating Body, and this tells a lot of the things that happened through that. I've been the chair of it for about the last, 14 years, and you can see all the great things as a collective group that we do. And you can connect with us lots of different ways. You can follow us on Facebook if you do Facebook or Instagram. We also have a really good website that's pretty easy to navigate. We also have a CMH YouTube channel. Anytime we do trainings, things like that, we post them to our YouTube channel. And if you want to watch them there, you can. And, if you want to sign up, we have a monthly email newsletter. And if you just get your email to me, address anybody, we will make sure you're on the monthly list to get that. You can also join it by going to our website. And that's it. Just a little over, sorry. I don't know if you have any questions for me at this time.
So first, I want to thank you for putting this together for us, and anyone in the audience that would like a copy of that presentation. It is part of the board packet, so it is available online. So you have access to all those phone numbers and resources there, so it is a great place for you to kind of reach out. This time, I'd like to open it to questions from any of the commissioners.
Can I say two quick things while they're thinking if they have a question?
Sure.
We're partnering actually with Port Huron Prowlers. They actually reached out to us, and so on March 21st, and we have it in your packets, and it's also, we left cards out there for anybody else that might be interested. It's a face-off for mental health night. There's a heavy emphasis on mental health and why it's important. We get to participate in the, I was going to say,
Chuck-a-puck?
No, the puck drop,
Oh, the puck drop.
I was trying to think, I was going to say puck off. My husband would have killed me if I said it like that. And I had a hockey player son. But anyways, we do some stuff there. It's kind of fun. We also have our 17th annual Run for Recovery. You're shaking their heads, yes. And that's a 5K run, walk, et cetera. It's on May 10th. It's always the second Saturday of May. It's a great event. Last year we had over 400 people. We're hoping to get over 500 this year. We have a lot of the mascots there too, like Levi the bear from McLaren Hospital, the Prowlers mascot. We always try to get Sparty and is it Mitz or whatever, the Detroit Tiger guy. So we'll see, you never know. But that information's in there. So I just want to tell you about those two things.
Any questions at this time? Steve?
Just ask, Gary, if you could just comment the difference between a commission and an authority, because this is a mental health authority, correct? It's different than a board or commission, and sometimes people are kind of confused on just generally how that works.
Yeah, so the community mental health used to be a department of the county. There's a law that allows them to become a separate authority, which is a separate legal entity. They could sue, be sued, have contracts, receive funding, that kind of thing. And CMH split off from the county with approval of the board and established an authority in, I don't don't remember what year.
It's in her slide.
About 2000, it's in the slide.
Yeah.
It started in 2000 and it.
See how
wait,
much
it
I was
effective
paying
that year,
attention,
yeah.
sorry, but anyways.
It's 2000.
Yeah, so it's been a long time, but so now they are a separate legal entity.
They have their own governing board, and they manage their own authority.
That's it, yeah. Just like this board does, they have their board and run their organization.
Thank you.
You're welcome.
But this commission appoints those board members.
Right.
Right, yeah, okay. Any other questions for Deb?
I have a question, Deb. Thank you very much for your presentation. Very, very helpful. I'm learning the county system, obviously, just being sworn in this year in January. Your advisory board, is that open to the public to attend the meetings?
We actually have two things now that you say that. We have the St. Clair County Community Mental Health Board of Directors, and that's the legal governing board. They're open, and those are on the second Tuesday of the month. And then we also have an advisory board, and we have a number of people on that, and that's also open to the public. And often, the advisory board has served somewhat as a feeder system into our board so that people have more experience and knowledge about the mental health system. It is a pretty vast system, but yeah. They're both open.
And when is the advisory board meeting?
We just switched the date. Kathleen, do you know?
Okay.
Yeah, because we just switched it, so.
I'm assuming even commissioners would be welcome.
Of course.
Thank you.
We've had commissioners come over the years.
Thank you.
You're welcome.
I got just the 1 minute question.
Sorry.
Infant mental health. How many infant mental health do you have that come out of the 7,000 that you see per year?
Kathleen, you know that number?
Okay. I was just curious on how an infant would have a
I
mental
know it
health
sounds
issue.
funny that way, but yeah, it's more up to help the parent and child connect and bond and all those kinds of things. So, yeah. All right.
Any other questions at this time? All right, well, thank you very much, Deb.
You're very welcome. And I also would offer, if anybody wants to come and have a tour of our building and talk more in depth about any of it, I'm happy to do that. In fact, I'm meeting with Commissioner Angie tomorrow. She's coming to see me. And so I'm happy to do that for anybody else. I like talking about our agency. Thank you.
Thank you. Any conceptual initiatives this evening? No old business. Moving on to new business 7A, the St. Clair County Library System Maintenance Agreements for copiers.
Make a motion, send to the full board.
Second.
Any discussion? All in favor?
Aye.
Any opposed? Motion carries. Item B, St. Clair County Library System Midwest Tape Hoopla Digital Media.
Motion send to full board.
Second.
Thank you. We're excited about that one. Any discussion? All in favor?
Aye.
Any opposed? Motion carries. Item D, the Community Mental Health Board reappointments.
Did we do
Missed
C?
Oh,
one.
sorry, I got excited. St. Clair County Library System Overdrive Incorporated Subscription Renewal.
Motion to send to the full board.
Support. Thank you. Any discussion? All in favor?
Aye.
Any opposed? Motion carries. So item D, I'm excited about it because there's so many applicants that no one ever clamors to be on a board. So it's exciting to see the community get involved. So the Community Mental Health Board reappointments. Can I have a motion to send that to full board?
So moved.
Support.
Any discussion?
Yeah, I believe we got 9 applicants this time for 4 positions.
Yep.
And if we get any more in between now and then, would they be included at the full board meeting?
Yes, we will.
Okay.
So I did have a question, Carrie, for you. I know that with mental health and it's being its own authority, that there are some Michigan state laws that help dictate who can be on those boards. Have we vetted that through I think it's, I have it, MCL section 330.1222.
Is that apparent from the application, maybe? Is that what you're?
It's not on the application to my knowledge, and I just want to make sure that as we are appointing people, that we make sure that we're meeting the state's criteria.
So we do our best to review those. We also send those over to CMH for assistance as well.
Okay, All right, thank you for that. Any other discussion?
On other human services matters?
Uh,
Oh, I'm sorry, you haven't moved on.
No, we haven't voted yet. We were in discussion for item D, so all in favor?
Aye.
Any opposed? Motion carries. Now, item 8.
Thank you.
Commissioner Felix.
Commissioner Beeden, I have a question. As you know, I'm on the Health Advisory Board, and at the last board meeting, it was brought up, Dr. Nevin's report on the mental health aspects of that. I know that that was forwarded to corporate counsel. I just am asking at this time, have you received that? Are you waiting on any information from anybody that we can help with, or are you set on that?
Well, here's where we're at. We had objections from one of the power companies, their lawyers. We reviewed that. We did an opinion. We had a meeting. It was Dr. Nevin, Liz, Carrie, me, Al Francis from our firm. Who else was there? Dave? Greg. Yeah, Greg Brown, and I think that was it. And it was a very good meeting, and we're doing our homework. I would just say that whatever it is, the department issues, both Liz and Dr. Nevin want to make sure we are on rock solid ground, and that's where we're going to get before we go ahead, because I guarantee you, whatever it is we do, and I mean we, the health department, and whatever regulations they bring to this board for approval will be challenged, and we don't like to lose, so.
Understand. Thank you very much.
Any other human services matters this evening? Hearing none, we'll move on to item 9 for information only.
Motion to receive and file?
Thank you.
Support.
All in favor?
Aye.
Any opposed? Motion carries. Item 10.
Move to adjourn.
Second.
Okay.
And receive and file.
We skipped number 10.
Oh, sorry.
That's all right, we're excited. So item 10 is to receive and file packets at our place or anything that's been distributed to us this evening.
I'll make that motion.
Support.
Thank you. All in favor?
Aye.
Any
Motion to
opposed?
adjourn.
Second.
All in favor?
Aye.
I hope the next meeting is just as exciting.
It's not me, I'm last.
All the way for you, sir.
Yeah, no, I didn't pay attention today. Let's call the Judiciary Public Safety Committee to order. Roll call, please.
Commissioner Angie?
Present.
Commissioner Beeden?
Present.
Commissioner Trello?
Present.
Commissioner Samasco?
President?
Commissioner Felix?
Present.
Commissioner Rushing?
Here.
Commissioner Vandenbach?
Here. Any additions, changes, or deletions to the agenda?
Make a motion to accept the agenda as presented.
Support.
Any questions? All in favor?
Aye.
Aye.
Opposed? Carried. I have no citizens to be heard. Moving on to, we have no updates and no conceptual initiatives and no old business, so 7A, professional liability insurance for public defender's office for final action.
I'll make that motion.
Support.
Any questions? Hearing none, and all in favor?
Aye.
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 Are we going to need to roll call vote on final action? Roll call vote, please.
Commissioner Angie? Yes. Commissioner Beeden?
Yes.
Commissioner Trello?
Yes.
Commissioner Samasco?
Yes.
Commissioner Felix?
Yes.
Commissioner Rushing?
Yes.
Commissioner Vandenbach?
Yes. Resolution 25-05, revising indigent defense council rate pay for public defender.
Make a motion to send that to full board?
Support.
Any questions on that? Hearing none, all in favor?
Aye.
Opposed? Carried. Fiscal year 2026 Michigan Indigent Defense Council grant application.
Motion to send to full board.
Second.
Any questions on it? Hearing none, all in favor?
Aye.
Opposed? Carried. 7D, Michigan Learning Collaborative Support Medications for Opioid Use Disorder in County Jails, grant application.
Make a motion to send that to full board?
Second.
Any questions on that one? Hearing none, all in favor?
Aye.
Opposed? Carried. Anyone have any other judiciary or public safety matters? Hearing none. Can I get a motion to receive and file packets?
So moved.
Support.
All in favor?
Aye.
Opposed? Carried. And adjournment.
Motion to adjourn.
Support.
At this time, I'd like to call the Board of Commissioners Environmental Public Works Committee meeting to order. May I have a roll call, please?
Commissioner Angie?
Present.
Commissioner Beeden?
Present.
Commissioner Smasko?
Present.
Commissioner Felix?
Present.
Commissioner Rushing?
Here.
Commissioner Vandenbosch?
Here.
Commissioner Trello?
Present. Is there any additions, deletions, or changes to the agenda?
I'll make a motion to accept the agenda as presented.
Support.
Thank you. Any discussion? All in favor?
Aye.
Any opposed? Motion carries. Let's see, I do have a few citizens wishing to be heard this evening. Chris Bartow, in regards to solar.
Good evening. Chris Bartow from Clyde Township. May 2023 is when I found out about the industrial solar project in our area. It's been almost 2 years now. For others in the county, a lot longer than 2 years. I'm hoping that Mr. Fletcher has the solar regulations back to the St. Clair County Advisory Board of Health as soon as possible so they can move forward. Thank you very much.
Thank you. Dawn Davy?
Hello. First time I've been here before. I wanted to ask the commission, because it's brought up at Algonac Council meetings, I'm Mayor Pro Tem, about the brownfield. Now, it is my understanding, as far as the city goes, that this is not an issue. And I believe that it's a dead issue as far as the county goes. The reason I'm asking you is because former Mayor Tesh has brought it up to where to let people know that they should be concerned because we have a millage coming up in Algonac Community Schools. So what I'm asking for is some clarification because like I said, I believe it's a dead issue here and I know it's a non-issue in the city of Algonac. So I'm hoping that we can get some clarification as far as the county goes. And since Deb had brought up, I am also on the board for the ARC of St. Clair County. And there's a fundraiser that's going on with the Port Huron Police Department and the Port Huron Fire Department in a hockey game. That all the proceeds are going to go to the ARC of St. Clair County. And that is on March 14th. Game time is 7 p.m. at McMorrin Place. So I just want to throw that one in there too. Thank you.
Joy, would you have any objection if Corporation Counsel commented on that? Because I think, Gary, you're familiar with that, aren't you? I am, yep.
I have no objection.
To answer your question, it's a dead issue here. So the last term of the board ended. It was never brought up again for a vote. And so now that it's a new board, it would have to be reintroduced by somebody, and it's my understanding there's no plan on doing that. So I think I could safely say it's dead here, too.
Thank you so much for clarifying that.
Joy, just for my clarification, the city of Algonac can, I believe, they do their own brownfield and it'll affect their taxes in Algonac alone, where it won't affect any county tax collections.
No, they could have a brownfield, but they don't. And if their brownfield approved it, it would capture taxes just like a brownfield here. They just happened to use the county brownfield authority because they didn't have one.
Okay.
And I think in this county, I think only St. Clair County and the city of Port Huron have a brownfield.
Okay, so.
And if I'm not mistaken, that was, before it came to our council, it was approved by the county brownfield authority, if I'm not mistaken.
I think what happened is the county brownfield board approved it. The
Yes.
county board of commissioners that makes the final
Right, it
decision.
went from the
said no.
brownfield at the county and then to us and then to you guys.
The county board
But,
said no.
like I said, I'm Mayor Pro Tem in Algonac, and as far as I'm concerned, and after speaking with the city manager today, that us doing a brownfield on our own isn't a plan as of this minute. So it concerns me that having a school millage vote is being tied in with a brownfield that's dead with you guys, that's a non-issue with us. So like I said, I just wanted to get some clarification from your end. So people don't worry that we're going to vote no on a school millage over a brownfield that's not an issue. So that's the only reason I'm asking you guys about it. So thank you very much,
Is
and I
it true
really
that-
appreciate it.
That core cap plan was fashioned in a way it didn't affect the schools, I believe. Wasn't that, I may be wrong on that.
Yeah, I think the schools were exempted from collection, and the state school tax can't be anyway, so.
Right.
Yeah,
And this is just a renewal of the millage. This isn't asking for an increase at all. It's just a renewal, so.
I think you could safely say the two have nothing to do with each other.
Thank you. I really appreciate it. Have a good night.
Thank you. Sandra Richardson?
Sandra Richardson, Fort Gratiot Township resident, and I just want to thank the board for the work they're doing on trying to look into the solar projects in our county, and I know it's, us as residents sometimes get anxious and wonder what is being done because we've been faced with this kind of from the back door, you know, so we never know what's going on. So the reason I'm here again tonight is to thank all of you, and I know it's much more work than what you have been given to help us with is much more than we can even understand. So I'm here to let you know that we continue to follow this project as much as we can. We went to a meeting last night in Fort Gratiot, and it kind of sets you back a little bit, and you wonder what is going on, because they indicated to us that they continue to have conversations with these companies that are pushing to start their projects. And when you live across the street from where this project would be, it is hard on your health and your nerves, and you're wondering where you are going to be going forward. So just so you understand what we're facing as residents, and I'm sure you know, and we just feel like a very vulnerable population out in the rural area. And I asked our township supervisor, because he indicated he had the conversation, which was nice, he was that transparent to let the residents know that he just heard recently from Ranger Power. And I asked him, I said, what was their feedback on the concerns of us residents that are concerned about our health and welfare and our Great Lakes? As my husband and I sit here and watch the rain most recently come into the, just flooding the ditches and traveling right into our Great Lakes from where these proposed areas are. And I said, was that company that's coming in to do this project concerned about our health and well-being and what we're looking into? And he said, no, they're not. So that gives you an idea of the companies that we've chose to deal with in our township, and I just bring caution anyone that would consider dealing with any of these solar companies, because they're not out there to be concerned about our health and well-being. They're out there to fill their pockets, and I just want to thank you again. Thank you very much.
Thank you. Jill Bartow?
Good evening. I'm Jill Bartow from Clyde Township. I just want to 100% agree with what Sandra has said. This solar stuff is ruining our lives and just going to kill us if it goes in across the road from us. Thank you for everything you're doing, and we really appreciate your hard work with it, and please advocate for us. We need your help. Thank you.
Thank you. Dawn Falk?
Good evening. Bob, you beat me to Mr. Fletcher. I wrote this up earlier and Bob beat me, but I'm going to read it anyway. My little statement here. You've had our Health Department Medical Director, Dr. Nevin's memorandums ×2 and recommendations for local regulation of eligible facilities subject to Public Act 233 of 2023 for almost 2 months now. I'm requesting an update, which we already received from you, so thank you for that, of the progress of the ordinance your law firm has been tasked to write. Many of us involved with this community of people who'd be directly impacted by these installations are patiently waiting a rough draft of this ordinance. These vulnerable rural people throughout St. Clair County have been going to the township meetings for years at this point. Many are disappointed by their township's response to these big companies wanting to come into their communities and install these unsightly Chinese-manufactured solar installations and substandard Chinese-made noisy inverters. This has been causing undue anxiety and stress to these residents. This ordinance would be very impactful for not only St. Clair County residents, but I believe throughout the state of Michigan, and I believe throughout the United States. So I guess I wanted it done, for these people yesterday, but I realize after listening to you speak, it's going to take a while, but, we just want to have it done ASAP. Thank you.
Thank you. Vance Richardson?
Vance Richardson, Fort Gratiot. I have worked with community mental health for over 12 years on a residential home. It's not easy. I've seen the ambulances, the fire trucks, the sheriffs, the whole 9 yards. People live that way. They struggle that way. Community mental health has been very positive in this regard, and I give them my highest respect, my highest regards for the work they do and their steps that go forward. But where I'm going with this, down the road here, is not just for me. It's for the community, it's for the township, it's for the county. The solar stuff is bad. If you go down Brace Road, like my wife was up here and says, the streams are flowing right into the Great Lakes, right into the fields where these solar fields are proposed. In the fall, we watch the cow manure flinging all over the place, less than a little over a mile from going into the Great Lakes. Now, as soon as they can, they want to put solar fields in here, put their equipment out there and just tear the hell out of these fields so we can have solar farms. Now, can you imagine for a moment, put yourself in these shoes, living in a group home and struggling with life in a solar field area, where you look out the window and there's the solar field like a prison, like the fences, and the noise that never ends, that whiny pitch. Yeah, like a mosquito, it's about that annoying. Or you can imagine going and visit your parents that live in that field, that grew up there and lived all their life, and now they're through this imposition of these ordinances that we didn't ask for. Now your parents, you have to go visit them and see these fields, 20-foot high, whatever, solar panels and noise. Or if you bought a home there and spent your life savings, only to find out you're gonna be surrounded by this. Or worse yet, you live there. And you have to get up in the morning and look out, and your home that's your peace and comfort and residence and where your family grew up, Now you've got to look out there and see these fields full of this mess and listen to the noise. And you're right. The developers, the Ranger Powers out of Chicago, they come and they make their mess. Look at Shiawassee. Years ago, I said, why don't you fix your mess before you come to St. Clair County? And yet you go out there today and Shiawassee's still a mess, and the noise is still a mess, and the developer's on chasing other thousands of acres of farmland that they can destroy. Imagine listening and living in these environments.
You got to wrap it up, 3 minutes, thank you.
Okay, so I will wrap it up, but I urge you to pursue whatever measures we can take to put an end to this mess.
Thank you. Dr. Catherine Albright?
Good evening. I apologize for being barefoot. My shoe actually broke on the stairs coming up here. I'm here for two reasons. One is I wanted to update folks on the commission with the work that I've been doing in Shiawassee County. But also, it has come to my attention that there's a position available on the board, actually several positions for St. Clair Community Mental Health. If there's one thing that I've observed in my several months of working with the community here, it's that we have an impending mental health crisis on our hands having to do with the solar. I have been out to Venice Township, Lennon Township, Shiawassee County. I've spoken to many residents. I've interviewed people in wheelchairs. I've interviewed people who have lost their homes, their livelihood, their view, their well-being. And they are reporting mental health crises there that I think are severe. Here I am hearing about distress, anxiety levels. At a meeting here a couple of months ago, there were people in tears reaching out for help. I know of people who have been to their doctor in recent weeks with high blood pressure, with severe anxiety, insomnia, just a whole constellation of concerns about these mental health, just about the solar that's coming and how it will impact their well-being and their livelihoods. And I'm sure many people in the room are nodding in agreement. I know some people have had shingles and all kinds of stress-related problems. My background, I actually moved here in 2020. My background is I have a doctorate in human development and psychology from Harvard University, where my research focused on consumer education and supporting developing educational materials and doing research to support underserved and vulnerable populations. So here in this county, I believe that someone is needed to step in and be able to actually look at the mental health effects that we're seeing in other counties and other parts of the country as well. I've heard from people as far away as Missouri, Massachusetts, other places that are suffering with this. I've heard from family members, older people whose families are moving away because the solar is coming in, including in Bad Axe. Pastor Anthony Farrell and I last night had a meeting with a family that's considering that. So I just want to let you know I'm doing the research. I have been interviewing people, doing qualitative research. I have developed a survey that I've been administering. And as I see the concerns here in this community and the very severe distress that people are experiencing, I believe that community mental health needs to really look very closely at the concerns of the community and the potential mental health problems that are resulting from this. So.
Thank you.
And if there's any questions, happy to answer them. Otherwise, thank you for your time.
Thank you. Are there any other updates for the commissioners tonight? None. Any conceptual initiatives? None. No old business. Moving on to new business, item 7A, which is contract approval for Genoa Contracting. It is for the Columbus County Parks Operations Center.
I'll make a motion to send it to the full board.
Support? Thank you. Any discussion?
I've already talked with our director. I think it's a very needed building, and I think the price, and they're going to get it's a needed facility we need at the Columbus Park. That's it.
Thank you. We do have Dennis here if anybody else has any.
I talked to him prior to.
So all in favor?
Aye.
Opposed? Motion carries. 7B, the contract approval for the Premium Group Associates North Channel County Parks Phase 1 development.
Make a motion, send to the full board.
Support?
Any discussion? All in favor?
Aye.
Opposed? Motion carries. Item 7C, landfill materials. This is for asphalt trucks contract. It's Amendment B.
Motion sent to full board.
Support.
Any discussion? All in favor?
Aye.
Opposed? Motion carries. We have item 8, the Smith Creek landfill activities report. Can I get a motion?
Make motion.
Support.
Any discussion? All in favor?
Aye.
Opposed? Motion carries. Are there any other environmental matters for this evening? Can I get a motion to receive and file packet?
So moved.
Thank you.
We need a motion for the Drain Commissioner's annual report.
Well, I'm not done with number 9.
Oh.
I'm waiting for a second motion. Somebody want to?
I'll make a motion to receive and file Drain Commissioner's annual report.
There's one. Any discussion? All in favor?
Aye.
Opposed? Motion carries. Motion to receive and file packets.
So moved.
Support.
Oh, any discussion? All in favor?
Aye.
Aye.
Opposed? Motion to adjourn.
So moved.
Second.
Mr. Chair, Steve, could we go to Ways and Means and then,
Anyone have an objection? What do you want to do?
if we could go to Ways and Means, and then the Sheriff's Department can,
Any objection?
I would support that.
Yeah, if no objection, we'll suspend the rules and do the Ways and Means next so we can get some of those folks on their way.
Sure.
Thanks, Dave.
should have did it earlier.
Calling to order the Ways and Means Committee of the St. Clair County Board of Commissioners. May I have a roll call? Commissioner Beeden?
Present?
Commissioner Trello?
Present?
Commissioner Samasco?
Present.
Commissioner Felix?
Present.
Commissioner Rushing?
Still here.
Commissioner Vandenbosch?
Here.
Commissioner Angie? Present. Item number 2 is additions, deletions, or changes to the agenda. Does anyone have any?
Make a motion to accept the agenda as presented.
Support.
Any discussion? Motion carries. I have 2 citizens to be heard. First is Sheriff King.
Good evening. I'd like to start off by thanking the board for considering the matter in which we're here to talk about here, and I'll talk about it in a minute. For those in the group that, or in the crowd that doesn't know why half the Sheriff's Department is here, is because we're here to support Jeanette Weiss. Jeanette is the wife of a deceased corrections deputy from our department. Deputy Gary Weiss served nearly 20 years at the St. Clair County Sheriff's Office and died in November 2024 unexpectedly. He was merely about 3 months from his 20-year mark, which would have made him eligible for health care, as well as his wife. Deputy Weiss was an active member of the Sheriff's Department, a well-respected person within the community, and had all intentions to finish his tenure to receive that benefit for him and his wife. The tragedy is bad enough on its own, but when it considered it totally and completely devastated financially, the forward planning of Jeanette and Gary, it really got compounded. We've had a lot of talks about what we can do with this, and the board's been gracious in speaking with us about this matter. We're looking to get the 3-month span accepted as a 20-year so that Jeanette can get that benefit. I would like to point out that this isn't an instance where an employee left before meeting the mark. I've been at the sheriff's office for 27 years. I've seen people get close and decide to leave. And when they do that, they make that decision and they leave benefits behind. This wasn't the case. It was a tragic death of a beloved deputy and husband, friend, brother. I could go on and on. I think we have an opportunity to do the right thing here for one of our employees and his family. And then looking forward, I think it gives us the vision to look forward to what we can do to make sure that if there is tragedy and somebody's very close to a specific benefit, there's a way for the family to bridge that gap. 3 months, that's all we're talking. Again, I understand that these actions we take, especially when we're talking about employee benefits, are very impactful and can be impactful down the line too. And I do respect and understand that the board and corporate counsel has an obligation to protect the county from certain financial burdens. But I'll remind the board that the benefit of health care after retirement has a sunset date. Very few people left in the county will even be eligible for that benefit. I think we have the opportunity to do the right thing here today and look forward on how we can come up with a policy so things are set in place and family members and employees aren't wondering what if or what now. So again, I thank the board's time for this consideration. I thank the Sheriff's Department employees for coming out and supporting Jeanette, and I beg you to consider bridging that gap and allowing her to get that benefit. Thank you.
Thank you, Sheriff. Jeanette Weiss?
Good evening. It's my first time here. I just want to thank you guys for letting me speak tonight. My name is Jeanette Weiss, and I'm here tonight to honor my late husband, Gary Frederick Weiss. He tragically passed away due to complications from a surgery that he recently had. His unexpected death occurred just a few months short of completing 20 years of service with the St. Clair County Sheriff Department. My husband held a deep admiration for my father, Charles Trescott, who was a retired lieutenant from the St. Clair County Sheriff Department. Following in my father and his father-in-law's footsteps, Gary also joined the department as a corrections officer. Gary's work ethic was something to be admired. He was loyal, dedicated, trustworthy, and fully committed to the oath that he took in March of 2005. To Gary, this oath was sacred, and he considered it to be a profound privilege to serve and protect his community. He regarded his role in corrections as part of an honorable profession, and his personal courage and strength were evident in his actions. He would often go above and beyond to ensure that his duties were carried out with accuracy and commitment. His fellow officers had shared numerous stories about the willingness to act swiftly in the times of need, always putting the safety of his colleagues first. Gary's dedication to his work was unwavering, and his commitment to the public service was evident throughout his entire career. Despite the challenges and personal sacrifices that Gary made, including missing holidays, birthdays, and anniversaries, Gary remained steadfast to his role. His loyalty and devotion to his job were demonstrated by the fact that he held only 2 jobs in his lifetime. That is a testament to I'm very nervous. To his reliability and work ethic. Gary's ultimate goal was to serve for the St. Clair County Sheriff Department until he met the necessary requirements for retirement. He had numerous discussions with his sergeants and lieutenants on how his plan would ensure to secure the retirement for our family. Tragically, those plans were cut short. The loss of Gary is the most devastating heartbreak I've ever endured. Over the last 28 years, I've watched him timelessly work to secure his pension and benefits, often working through illness to avoid letting his team down. Now as a widow, I'm left without the opportunity to retire with the man that I loved, to celebrate the milestones and moments that he sacrificed for his job. Though I only have 3 minutes to speak about this incredible man, I could speak for hours about him. Both to me and his colleagues, I respectfully ask for your understanding and consideration. I am requesting the benefits my husband worked his entire life to secure with the St. Clair County Sheriff Department. It would be a fitting tribute for his unwavering service and dedication. Thank you for your time.
Thank you, ma'am. Thank you. I have no further citizens that wish to be heard, so moving on to number 4, I'll ask for any updates. Hearing none, we'll move on to number 5, conceptual initiatives. Hearing none. Number 6, doesn't appear there's any old business either. So moving to number 7, new business. A, the Health Department subrecipient agreement with Yale Schools for adolescent health construction contract. Can I get a motion to move that to full board?
So moved.
Support.
Any discussion? Can we vote? All in favor?
Aye.
Opposed? Motion carries. Letter B, contract approval, Thermalnetics Intervention Center. Motion to move to full board?
Make a motion, send to full board.
Support.
Any discussion? All in favor?
Aye.
Opposed? Motion carries. Item C, change order, courthouse elevator refurbishment, the gray elevator refurbishment. Motion to move to full board?
Motion to send it to the full board.
Second.
Any discussion? I have a question for Carrie. You probably don't know the exact amount, but being in the courthouse as frequently as I am, I know that there's been a lot of work done on both the gray elevator and the other one. Do you have an estimate in your head of how much money has been spent trying to fix these elevators over the last 5 years?
I can get that for you.
Thank you. Thank you. I'd appreciate that. Did we vote on that?
We have not.
So all in favor of sending that to full board?
Aye.
Opposed? Motion carries. Item D, purchase agreement with Woda Cooper Development, Inc. for the Robin Crest Housing Development.
I'll make a motion to send that to full board.
Support.
Any discussion?
We have Mr. Freed from the city and representatives from WODA Group here to talk a little bit about the program.
Please.
Good evening. Let me make sure the clicker's working. I will make this very, very brief. It's good to be here, and I did such a large audience, a lot of officers here and sheriff's deputies here. I will say, just real quick, we have one of the best sheriff's department in the state of Michigan. I see things the public doesn't see, and just amazing, hardworking, dedicated folks. And so thank you, Matt King and Sheriff King, for your leadership. Just a dynamite team. So I'm bringing you a proposal tonight, and you ask, well, why are we coming to the county for this, and why now? There is a funding opportunity through MSHDA for some tax credits to help onboard some additional workforce housing in the state of Michigan. And in the city of Port Huron, we have several major issues, but the number one issue is the housing shortage. Let's get this to work right. So it takes a second. There we go. So the city of Port Huron is facing a housing crisis, a housing shortage. We have very, very little stock, and the stock that we do have, the rent rates are doubling. Housing prices have risen by more than 50% in the last 36 months. To put it candidly, the school buses go to the hotels to pick up our children because we don't have enough workforce housing for these families. We literally pick up dozens and dozens of kids from hotels. The City Council commissioned 2 previous housing studies to define this challenge. The first study we did was in 2017, identified the missing middle, which is like a housing component, like a row housing or a small condo. We had a lack of that, which we addressed with a lot of onboarding of condominiums at Wrigley Center brought on 36 developments. We had about 200 to 300 new condominium units, apartment units brought into downtown to address that. Then we did a comprehensive housing study, which was conducted by a company called Zimmerman Volk out of New Jersey. They're the foremost housing experts. We completed that in 2024, and it's staggering just the depth of need for workforce housing in the city of Port Huron. Rising interest rates and construction costs have made onboarding new housing stock extremely challenging. The cost of building with the interest rates has made a lot of developers very gun-shy about starting any new type of development. New units without funding from tax credits or some type of tax incentives are oftentimes out of reach for many of our residents. We're a working class community. We're not rich, but we work hard to get by. And part of our housing study showed us that the demand for the housing prices were much higher than what our area could afford, further exacerbating the problem. The lack of workforce housing is a leading driver to housing insecurity in the community. I think we can all agree that kids shouldn't grow up in hotel rooms. Kids should have a home and a bedroom to go home to at night. And that's why I'm here tonight. The funding opportunity, we have to get this application into MSHDA by March 31st. There's a lot of things that have to happen before that time. The site we have proposed here, first I want to talk about the developer. The developer is Woda Cooper Companies. They operate 315 properties. They have 16,000 units. They are the world's foremost workforce housing developer in the Midwest. I put a map up here of where all they have, a portfolio of $1.5 billion. This is the world-class developer. They have done numerous developments throughout the state of Michigan, from Portland to Sault Ste. Marie. I have called all of those cities and thoroughly vetted this developer before we ever brought them to the community. We were working on 2 projects with them right now, so they're the real deal. This is a group that gets it done and has a stellar track record of onboarding high-quality product that really addresses the needs of each community. And I have Pat Olding here tonight from Woda Cooper Group as well. The site. So why the parking lot site? As you all know, the city, when the county bought this property to build this, it came along with this parking lot, which we really never had a use for. And you may say, James, why did we look at that site? And the truth is, one thing we've learned in the last couple of years is that we don't get to pick the sites. MSHDA has a rubric for scoring grant applications, specifically the parcel itself. And the rubric is very complex. And some properties in the cities, which you think would be ideal, score very, very low on a MSHDA rubric. And so we most likely wouldn't, it's very competitive, these applications for tax incentives. And so this site was actually chosen because it scores the highest in the area on the MSHDA rubric. Meaning if I move this development to another area in the city, it wouldn't score as high. And there's a whole host of issues like walkability to a library, to services, to a grocery store, to jobs. This site scores very, very high. And so this is a site plan, which, is subject to a little change because of topo, and we want to make sure it fits in with the area, the outside and all that, with the historic area as well. But it's a 52,000 square foot, 4-story building. Now let's get into what it has inside. I'll give you a rendering of the outside as well. That's a rendering of the outside, just a rendering of what it could look like. It'll have to go through all the historic commissions, everything to fit in with the downtown. We want it to fit into the community. And that's the inside rendering of what the units will look like. Pretty hard to see. I can send this all to you as well. Okay, so the development is going to be a $16 million development. It's going to be 50 units, 26 one-bedroom units, 24 two-bedroom units. 18 units will be set aside for chronically homeless. So what does that mean? Are we building a homeless shelter? No, we're not. These are for folks who are working, who can't afford a down payment or can't afford rent, so they're living with their families in hotels. These people are already here, they're already a part of this community, and they're already serving many of us in their day jobs. But we need to find a place to make sure they can call Port Huron home. It's very important. 32 units will be for general occupancy, singles and seniors and families. 44% of the units will allow the highest incomes of 80% AMI. So when you talk about workforce housing, I think the term affordable housing gets a bad rap. These aren't people making up to a single person earning up to $53,000 a year. That's about 30–40% of my staff, and I have 549 employees. That's a vast majority of county employees make about $53,000 a year. For a couple, it's $61,000. For a family of 4, it's up to $76,000. And the AMI for the county as a whole is $95,000. So for a family of 4, $76,000 a year, that's a pretty good income. These people aren't lazy. These are people who are working hard, who need a place to live. Collected rents will range from $430 a month to $980 a month. For the 1 bedrooms and the 2 bedrooms, of course, $475 to $1,150. So what are we asking tonight? So before, I want to read just real quick some other statistics here about what this site will bring. This site will bring in, so right now you have a parking lot that you do not use and you have not used for over 15 years. You didn't even bother to plow it the last decade. This will bring in taxable values of $310,000 over the next 15 years of new taxes. Additionally, we're bringing $780,000 to nonprofits like the Blue Water Community Action Agency through wraparound services to help these residents. So in total, not only are they going to invest $17 million, bring 50 units of workforce housing online, they're going to provide about $1 million of cash back to the community. So what we're asking for tonight is to enter into a purchase agreement for this property. Now, the key is we cannot apply to MSHA until we have a purchase agreement. And we need this property to do so. We're asking that the current purchase agreement you have has got a price point of $250,000. I believe the cash value of that property is about $550,000. But if you factor in the new taxes that this will bring in over the course of the next 15 to 20 years, it will add up to the $550,000, while also taking care of a critical need within our community. If the Woda Group is successful with the application, we would ask you to execute the sale. So what would happen is if you entered into a purchase agreement, we would apply to the state of Michigan for this highly competitive grant. I'll be honest with you, I don't even give us a 50-50 chance of getting it. It's that competitive. And so we're just taking a moonshot here on bringing more workforce housing. But again, when you got kids living in hotel rooms, you take the moonshots when you have the opportunity. So we would find out in July, in late July, if we were successful or not. We have done many rounds of this as a community, and we were just successful at the Lincoln and Erie project right across from McLaren. We're onboarding 40 units there with a $16.5 million project that will break ground this fall to help this critical need in our community. So that's what we're looking for, and I can answer any questions you have, anything you want to ask. I have the developer here as well to take any of your questions. I want to keep it short because I know you guys have a packed agenda tonight.
I have a few questions, Jim.
Yeah.
I looked at the plan for this that you submitted. It looks like a beautiful building. That's not it. I'm sure the Woda Group does a fine job. I checked them out, their work throughout the country. A couple issues I have. I wrote to our administrator controller and I asked, has the property been independently appraised? This is not the county's property, it's the people's property. So that's something I felt I needed to do. I hear your explanation, we're going to recoup it in taxes down the road, but I'm looking at the sale right now. Has this property been appraised? I know you had some answers for me earlier.
There has been no independent appraisal. I have had our equalization director review it, and that's where the 550 cash value came from.
But we don't really know what that property is actually worth. We can surmise, but I certainly wouldn't sell my property until I had it properly appraised. So that's one question you're not going to be able to answer, but I hope the board considers that. Secondly, I'm looking at the people that would be likely to be in this building. I noticed in your layout of the building, electricity was up to the applicants to pay, correct?
Correct.
And we're going to have people in that building, many of them that are going to be stretching to be in that building, even with the subsidies. They're people that are trying to get ahead. Do you know, do the windows in that building, are they going to open? Can your group answer?
So let's talk about the wraparound service.
Can you answer my question, please? Will the windows in that building open?
I'll bring the developer up.
Yes, please.
One of the things
I'll get to my reason. It's important.
Yeah, but one thing about the utility costs is wraparound services to help with that. So the good news is these people who are chronically homeless, which is a very small percentage of that building, there's wraparound services to help them with such as utility needs.
Okay, well, can you answer that, sir? Will the windows in that building open? And then I'll explain why I'm asking that.
Yes, that is correct. And then also to touch on the utilities. So the rents that we showed up there are the gross rents. So that includes the utility allowance within those. And those are all underneath the 30% to 80% AMI limits.
So the windows will open because I'm assuming they're not going to necessarily have extra funds to pay for their air conditioning in the summertime and the warmer weather. They may want to open those windows. So the question I have with respect to Mr. Freed, per Carrie Hapting's words here, she says there's quite a bit of odor from the sewer facility, Port Huron sewer. If these people are in this building and they want to open their windows, is this a place really that you'd want residents to live, much less residents that can't maybe afford the air conditioning, opening the windows? I'm looking at the human aspect of this.
Yeah.
If I put people in that building and they've got to run their air conditioning because they're going to be breathing polluted air otherwise, is that an ideal place for residents?
So in the municipal office center, our HVAC system is a differential, meaning we pump in outside air and then heat and cool the differential. So I spend about 50 hours a week right next to the wastewater plant, and it's just fine. One thing I would note is we do have an odor problem currently at the wastewater plant because our odor control system has failed. However, we are in the process of building an $8 million carbon filter system, which will be done in the next 24 months. So if this project is successful, the new carbon filter system for the wastewater plant will be completed and the odor system will be remediated.
That's good to hear. What would be the estimated completion date of this project if it's all goes accordingly?
Yeah, so we would submit on April 1st for the tax credits. We would hear back in July if we receive the tax credits. Then from there, we would go through the permitting and closing on our financing. That usually takes about 6 to 8 months. And then from there, we look at about a 12 to 14-month construction process. So it's altogether about 2 years from now is when the project would be complete.
Okay, thank you. Those are my two concerns. Thank you.
I apologize. I know that the cover sheet indicated that council had not yet reviewed the purchase agreement. I wonder if you've had an opportunity to do that, Gary?
No. So it didn't see, unless this was approved to go ahead, whatever reasonable changes are necessary, I'm sure we can make them quickly, because apparently they're under the gun.
Thank you. Does anyone have any other, Steve?
Sure, Carrie, equalization gave that a $560,000 cash value? Is that what you said?
Yeah, I did reach out and ask what they would estimate the assessed value to be.
My understanding of the equalization department is they have fairly thorough rules on valuation. It's not just, whim. So I think I would assume that property's worth $560,000 cash value. Would that be fair?
I do believe that would be very accurate.
And they want to pay 2 1/4? What do they want to pay for that?
The proposal before you is $250,000.
Can you explain, Jim, why wouldn't you pay true cash value for that?
So first and foremost, we would look at the tax value it would bring in to the county over the course of the next 15 years to help offset that. Again, for every dollar more we pay for that property, it's less likely that we can make affordable units available. And given this is a critical crisis for the county to have workforce housing, that was the reason why. But if that's something you want to negotiate, I mean, here's the thing. This is such a critical need within the community. It's like, I'd hate to see it not get approved over something as small as $100,000 or something. We're willing to talk about that, but we're just trying to get this done so we can get the application in.
There would be like a county incentive to the project, maybe, the lower price, and then we'll get it back later.
Yeah, and the truth is, the true cash value for a parcel that size, if you have your assessor, if you had an assessing look at it, I mean, it's been, how long has the county owned that? 15, 20 years? And I don't think anyone's knocking on your door to build a $17 million development next to the wastewater plant. And so there's not really a lot of suitors out there.
Anyone else?
I just think that this is an important project for the city of Port Huron. As someone who is sort of in housing and always looking at what's available in housing, there is a shortage, and the fact that we have this vacant piece of property in the middle of the city where there are bus routes for people and where a lot of these individuals probably will work in that walkable downtown, I just think it's very important to not only the county but the city, and I think it's important that we take a good look at this. It hasn't been used in 20 years since we've been here?
Well, since 1998 when it was purchased.
So, I mean, this would be an opportunity for us to reinvest as a county into property that we already own to really get the maximum value out of it long-term. So thank you to you and the city and the developer for looking at the city and trying to make this possible.
One of the things as well is Our unemployment rate is at historic lows. And I say we used to chase jobs, now we chase workers. One of the biggest impediments to filling the jobs, we have about 300 jobs open in our industrial park right now. These are high-paying advanced manufacturing jobs. They start at $23 to $24 an hour. They can't fill them because people don't have a place to live here. And so I talk to a lot of parents who have kids who graduated college or getting out of high school, and they can't live here because they don't have a place to live. And so this is really, the housing shortage is becoming a real impotence to our to fulfilling our full economic potential and filling these jobs. And so finding a place for these workers to live is it's kind of like the chicken and the egg. The housing or the workers come first. We have the jobs, we need the workers and a place for them to live.
Gary? Sorry.
I just wanted to point out something. Our equalization director is very sharp. He's an appraiser, but he doesn't do an appraiser of the appraisal of the property. So what he's saying is we value similar size properties with similar zoning throughout the area we look at X dollars, and that'd be the 550. But to get a real value, what you would have to do is get an appraiser in there. They're going to look at, okay, number one, who would buy this? I don't know, whoever would. Nobody's ever used it. Nobody's ever wanted to buy it. And then they look at the negative influences to the property, which is the wastewater treatment plant and whatever. So I don't know what that number would be, but if the general value based on the equalization process around the city would be 550, I would hazard a guess at, given where this is at, what its potential use is, the effect of the wastewater treatment plant, I got to believe it's a lot lower than 550. That's my opinion. Unfortunately, this has come so late in the game, there's no way you're going to get an appraisal done. There's not enough time.
Whose fault is that?
I don't know.
I can answer that. We had another site involved, and the property needed to be demolished, and the developer became unreasonable. The issue oftentimes is someone will list a property, and then when they find out there's a developer involved, they'll triple or quadruple their price, and that happened to us. We had a property just adjacent to this facility that we wanted to raise and build on, and the developer became unreasonable, and it couldn't financially make sense. And so we're close to the grant window. We say, okay, what else is in this high-scoring property range around here that we could work? And the adjacent parking lot is what made sense. And so that's the driver behind that. So had the deal not fallen through on the other property, I would have been here 2 or 3 months ago.
Anyone else?
I got quite a few questions. You stated that it was critical. Just because you say that doesn't mean it is critical. So we're going to be looking at this. How long has this proposal been being looked at?
So this proposal has been looked at probably for the last, I'd say, 2 months. But the similar proposal, we have looked at workforce housing at numerous areas of the city, whether it be the River District site, the Lincoln and Erie site. This is such a critical need for the community that we have multiple sites and multiple projects that we're looking at. Because when you go for MSHA incentives, it's not guaranteed. And so you got to look at every opportunity and take a swing at the plate. And we strike out a lot, but often, every once in a while we get a home run like the one at Lincoln and Erie. And so this is a very...
This project started 2 months ago.
We started looking at this project, that specific site, 2 or 3 months ago, yes.
So this started 2 months ago.
Not the parking lot, but the other, located at the other facility, correct.
And MSHA included the parking lot in this proposal?
No.
Okay. So it's been longer than that. You said there's dozens and dozens of school children in hotels currently. How many of these dozens of school children are going to be fitting into you got the 18 set aside. Is that where the school children are going to be going, or in all of them?
We're finding that the workforce, the ALS income population is very large. So you have folks that are making $30,000 to $50,000 a year who can't afford a place to live right now.
Okay, you said dozens and dozens of school children. That's one of your main issues for wanting to do this. How many school children will be in this facility?
Families. Let's talk about families. I'm telling you right now, I know that we have several hundred children who have housing insecurity in our school system. We know that. We know that the buses pick up kids at the hotels. We need to onboard as much workforce housing as possible. What we should also know is that we lost 208 units of workforce housing in the last 2 years. There was a development at the south end of the city, and when that timeline expired, we lost all those units. So they tripled rents and everyone was forced out. And so a lot of those people don't have homes now. And so we're trying to offset that loss as well.
So you don't know if there's going to be any school children that'll actually be in this facility for sure?
If you see the playground set incorporated in the design, we have to believe that kids will qualify.
In the single apartments, I can't imagine that school children would be in the single. So 26 of them are going to be out for school children. Potentially, the remaining 24 potentially would have an actual family in it and have school children in there.
Correct.
So I really kind of discount that you're going to say school children are going to be in this.
No, there's going to be for every population. You have seniors who are on a fixed income, single folks who are on a fixed income. This building is for all those people who are ALS income limited.
Well, you're also now verifying there may not be any school children in here, even though you brought up that it's for dozens and dozens of school children. Wrote down what you said.
What I'm looking at when we bring in onward housing projects, when we're onboarding, we're looking at the need in the community. It's holistic. Every population segment in this city has a housing shortage.
So I'm going to say the dozens and dozens isn't actually a factual statement.
We have dozens and dozens of kids who are
You're
homeless.
saying at least 24 children are going to be in there because dozens and dozens, that's at least a dozen. You brought it up. You're trying to sell this project.
Yeah.
I want you to come here and be truthful with us. And you're not being truthful with us with your statement.
Okay.
My next one is, you have a rental agreement for the north end and south end of this city. How come, and see if is it an ordinance or an agreement? That you guys don't rent the north end, you rent the south end?
There's no such.
There is no such thing.
No, we have a rental moratorium for certain zoning districts.
Exactly.
But it's both north and south end. It has nothing to do with either geographic
Where's the
location.
majority of the rental?
It's pretty blended throughout the city.
I know what I'm talking about here, and I'm going to say that north end, you look very limited, the rental properties in the north district, in your zones.
I would disagree. There's many rental units up there.
Well, I followed that when you did it a few years ago, and I'm going to disagree with you.
Okay.
In the current city of Port Huron, how many percentage of rental homes are there?
53%.
Huh?
53.
53%?
About there, yeah.
What happens when a city hits 60%?
So our number's trending down actually over the last several years.
that's
We've had
good.
several hundred properties flip from rentals to home ownership. But as the Zimmerman Volk study will tell you when they brief the council, 53% rental rate for a core community is actually pretty low.
The other things that I've been following is that once a city hits 60%, that becomes a dead city.
Okay.
You can't recuperate after you hit 60% rental. And you're saying that 53% of the homes in city of Port Huron are rental now.
Which is trending down, but I'm not sure where you get the 60% number from.
Well, go check some demographics.
Okay.
The health department, if you're not aware, is going to be moving into the south end of this building very shortly. They get a lot of people that come. And this is part of our county campus. We may need that. And to say that we haven't used the parking lot, I could ask Carrie, the state of Michigan, how come they have reserved parking lot signs and all over by that parking lot? If it hasn't been used when the state of Michigan was here, you're saying they weren't used even though they have signs for reserved parking. For 20 years, you said. Hasn't been used, but they got reserved parking signs.
Yeah, in fact, when we took over the parking lot to put our farmer's market there, we had to actually send our street crews in there to repair the maintenance so it wouldn't be a liability because it hadn't been maintained so long.
Well, I'm thinking it could possibly be an asset to the county for our residents, because I don't know the population that's going to be coming to this building and the parking spots that are going to be taken. If you get a two-bedroom apartment, potentially 4 people could live in there, right?
Yeah.
And they'd each have a car potentially.
Yep.
Do you have any rental parts that would be part of this agreement that a person would be limited to 1 car? Would an apartment be limited to 2 cars?
We have plenty of on-street parking available that we have done parking agreements with that they can park on-street. Same as we've done in the 3rd, the old warehouse district and Lincoln and Erie.
I was getting to that too. So you have a city parking lot you can use.
Yeah, we have plenty of parking.
So potentially, if somebody had 4 cars, 1 individual, they could park all 4 cars over there.
We have plenty of on-street parking. These are things that they can take care of in the rental agreements.
I don't think that, I think that's about all the questions I have. I don't think this should be considered at all. This is an asset to the county that potentially we're going to be needed for residents, for the health department. We give that up. Haven't talked to the health department. You said this has to be done by March 31st. You've had this for quite a while.
I have not, sir. This was not taken into consideration until the other parcel fell through, and we were looking for an alternative site. I got here as soon as possible. I emailed Carrie several weeks ago when your committee meeting was, and the first opportunity I got here, I am here.
Okay. Guess that's about all I have to say.
Thank you. Anyone else?
I have a question for Carrie. Do you know, at the health department, do you know how many parking spots that they currently have?
I don't, so the parking lot that in question was never used by the state of Michigan. So there are actually 3 separate parking lots over there. The state of Michigan had 2. There was one for employee parking, which is where the signs were, and then one that had customer parking. And this parking lot, we used to lease to AT&T when they occupied the building next door, and then when they left, that parking lot was just chained off for several years. But we have never used that parking lot for county business. But the parking lots that were occupied by the state is more than enough for all of our health department employees, customers with spaces to spare.
When this building was built, was it designed structurally to have another floor put onto it?
Yes.
So potentially, I don't know what's going to go on with the courthouse, but if that's going to need some major improvements at some point here, it was built in 1967, and if we decide to move the courthouse over here and add on to this building, was that part of the intention? Are you aware of it at all?
I'm not, that predates my time here, but this building was designed to add 2 floors, I believe.
So if we added 2 floors, what are we going to do for parking?
There would be spaces available in that lot and our lot on the other side.
So-
It would depend on who comes over here, how many employees.
Would the health department be the ones that would be, that parking lot right now, that would be dedicated to the health department, or it's dedicated to anybody that wants to come to county?
It would be mostly for health department customers and health department employees, but employees of this side of the building could park over there
So if
as
we ever
well.
did go and looking down the road, this ever got 2 more floors put onto it, and we needed a parking spot, where would we get that if we give this up?
We currently have a surplus of parking. I guess we could do a parking study to see how many surplus spaces we have.
All these questions should have been brought to us. He said as soon as he could have got here, and it has to be done, decision made by March 31st. I don't like that. Well, we don't have an appraisal of the property, which was requested. There's too many questions, and I don't want to give up the asset myself.
Steve?
Just, to me, I understand the need and understand your urgency. I don't like to do things fast in my law practice or in my county commission
Neither do
work. And I wouldn't recommend sending it to full board because there's too many questions. I tend to, when I buy property, I tend to hold on to it. We bought I call it the Bohm Dome, the old art van center. We paid $500 and almost $600,000 for it 15 years ago. The conversation I had with Bohm at the time was we were going to buy it, we're going to keep it, part of the county campus. We got property where the old jail was taken down, part of the county campus. This is part of the county campus. And I don't mind considering selling it, but the appraisal, all these other issues, and to just pop up and say, hey, we want to buy that and walk in and then just do it. I can't do this in 2 weeks. There's too many questions, so I'm not opposed to considering it, but I'm not going to pound a square peg through a round hole because somebody's got a, emergency to find a place to put some MISTA money for development. We got to think about this stuff. That's my 2 cents.
James, let me ask you, if the commission wanted to take additional time to consider and research and perhaps get an appraisal or the parking study that's been brought up, would that be acceptable in your timeline?
It'd be within 2 weeks, because we have the whole host of other steps that have to be done, including a pilot program, some site plan stuff with the planning commission to get it all to MISTA by the end of the month. So if this were to be moved forward, we would begin simultaneously moving forward on the city side to get this all set for MISTA approval. This is a moonshot, folks. I get it. I wish I could have come here 6 months ago. We have a critical need in the community. If this money is going to be spent in the state of Michigan, I hope it gets spent here. One of the issues you see in like Grand Traverse County and other parts of the community is their economy grows so fast that the people who work and serve that community don't have the ability to live within that community. And so we really want Port Huron to have a place for everybody.
Anyone else? Thank you.
Do we have a roll call on this?
Please.
Request a roll call.
Commissioner Beaton?
If there's was there a motion or no?
I just want to, well, you've already had the motion in the second, forward it to the full board. I just want to reiterate, for me representing District 6, I don't want to give up a county asset that not, a lot of questions have not been answered. And I think potentially we need to have that because our county campus is going to keep shrinking if we do this. So I don't want to give it up. So I just want to restate that.
Any further discussion? Can we do the roll call vote?
Commissioner Beeden?
Yes.
Commissioner Trello?
No.
Commissioner Samasco?
No.
Commissioner Felix?
No.
Commissioner Rushing?
No.
Commissioner Vanden Bosch?
No.
Commissioner Angie?
No.
Motion died.
Thank you. Moving on to 7E, that relates to the increase in years of credited service for Corrections Officer Weiss.
I'd like to make a motion.
Support?
Any discussion?
A little bit. I appreciate everybody being here. I mean, I really support my brother just retired from the corrections from 26 Mile Road. He just retired. So we spent a lot of time in there. So he talks to me. Of course, I'm not a corrections officer, but I can appreciate what goes on there. I'm going to support this 100%. I will not be here on the 20th. I'll actually be, hopefully, depends on where our next discussion goes. I might have to cancel my vacation as planned, but right now I don't plan to be here on the 20th. So I definitely support this one to go to the full board.
Commissioner Smaska?
I had a question. I don't know if it's for Carrie or for Corporation Counsel, but I looked at the NIHART benefits study piece of it, and I'm looking at scenario 1, scenario 2, and I understand what happened here with a fellow that worked for dedicated employee for many years for the county, a first responder, someone in our sheriff's department, works for just shy of his 20-year mark for the benefits that he was working for. So scenario 1, present value survivor benefit 19,000, scenario 2, 289,000. So Carrie, is that 19,472, is that the monthly benefit without medical, just on the pension side? Is that what that is? Or what am I looking at here?
So there are two different valuations, one for the impact to the retirement system, or the pension system, and one for the impact to the healthcare system.
Okay.
And I believe scenario 1 is the existing benefit as it stands, and then scenario 2 would be if the board were to grant the exception, and then that actuarial impact is the cost of that.
So the 19,472, is that like for based on the life expectancy of the widow? That's the total cost to the pension is only, or is that an annual cost? Do you know what that is? We can look at it before it goes to full board. In other words, you have a person that's 3 months shy. If we go and add the other 3 months to give them their 20-year mark, they're going to get probably a higher pension multiplier perhaps under the contract, and they'll get their health care, which is obviously very important. But so under the first scenario, like where it's at now, because of the terrible thing that occurred, the person, Jeanette, would only get 19,472 a month and no medicals, or is that?
So
Gary,
that.
you know what? You don't know how that looks
Yeah,
like?
that's the healthcare piece of it.
Yeah, and the reason it's so high is that when he passed away, just short of 20 years, so in St. Clair County, you have to work 20 years to get the retired health care. As the sheriff pointed out, I think it was, that there have been people that actually left a year or two early and went somewhere else, and they forfeit everything. So obviously, he didn't voluntarily leave to go anywhere, and it's a very sad situation. But so the bottom line is, if you're a day short or a week short, it's zero.
I get it.
So that is then the full cost of the benefit, as if it had not been lost because he didn't make it to 20 years.
So if you don't make the mark, like if Mr. Weiss passed away, and right now his widow would get a survivor benefit, right?
Pension.
Pension, she'd get her pension. So this is just the medical side we're looking at? That's
Yep.
all we're looking
The
at?
big number's the medical side, yeah.
Okay, the big number's the medical side, but on the pension side, the 19,472, the 19,472, it seems a very small number. If that's the total impact on the pension side, that's a nominal figure.
Well, and the reason it's nominal is everything he earned, he's still entitled to get. It's not an all or nothing thing. In other words, if he passed early, he doesn't forfeit his pension, it's
His
just
wife
less.
gets right, he gets it
Exactly.
right. And then on that particular contracts, I know over the years, some of these target dates hit actual pension multipliers. You go from 2 to 4 and all that kind of business. You know what I'm saying, Carrie? Is that
Yeah,
factored into this?
so there's two different valuations. The 19 that you're looking at, that's still the healthcare valuation. That doesn't have anything to do with pension. So he would have contributed, because employees contribute towards retiree healthcare. So he had funds available in the retiree healthcare trust. So scenario 1 is benefits as it stands today, and you can see the actuarial impact is 0. And then scenario 2, the actuarial impact, the 269,870 is the difference in the benefits.
I'm going to support,
cost.
I'll support sending it to full board, but I want to get with you to, I'm still not very clear on that, so I'll get with somebody and try and figure that out before the 20th.
Okay.
So thank you.
Further discussion?
Yeah, I have a comment. As many of you know, I came from a corporate world, and I campaigned saying you can't always run government like a business. This is one of those times. I unequivocally support giving the widow, and my condolences, what she would have had coming if he had retired as intended. So I would completely support this.
All in favor of moving this decision to full board?
Aye.
Opposed? Motion carries. Moving on to item F, policy revisions, 336, paid time off.
Motion to send it to full board.
Support.
Discussion? All in favor?
Aye.
Opposed? Motion carries. Item G, Resolution 2507, authorized signatories.
Make a motion to send that to full board.
Support.
Discussion? All in favor?
Aye.
Opposed? Motion carries. Item number 8 is other ways and means matters. I have none. Does anyone else? Nothing under information only. Can I have a motion to receive and file the packets?
So moved.
Support.
All in favor?
Aye.
Opposed? Motion carries.
Motion to adjourn.
Support.
In favor?
Aye.
Opposed? Carries.
Thank you.
Thank you, officers, for coming.
They don't like us anymore.
What do you mean anymore?
Right here. Thank you. Let the room clear for a minute.
Still don't get it. Don't get the numbers.
I'd like to call to order the Community and Economic Development Committee. May I get a roll call, please?
Commissioner Angie,
Present.
Commissioner Beeden,
Present.
Commissioner Trello,
Present.
Commissioner Smasko,
Present.
Commissioner Rushing,
Here.
Commissioner Vandenbosch.
Here.
Commissioner Felix.
Here. Additions, deletions, changes to the agenda. We're deleting a Michigan State University Cooperative Extension update. Are there any other additions or deletions?
Yes, what I'd like to do, and at your discretion, you did receive the email from our chair, Steve Smasko, requesting that we put EDA on for final action. I have a vacation that I've scheduled, and I've been going for 35 years. I cannot attend the 20th. So I would like the EDA for final action tonight, and that could potentially be 7B before we discuss 7 7B that's there now and change that one to 7C? Because that could potentially depend.
Oh, go ahead, I'm sorry. Go ahead, Dave.
That could potentially depend on the decision we make on the I-69 corridor next Michigan Development Corporation. So I was looking to final action EDA for 7B and then moving 7B to 7C.
Actually,
Would be my motion.
my email suggested we would talk about it, that we would determine whether to move it up a day, set it for final action, or put it on for committee for final action in April. My preference was final action because we've done so much with it. You know, I don't think there's any, for me at least, additional information necessary to make a decision. But I thought we'd have a discussion about what people prefer. Would they want to do final action on that tonight, or would they want to move it to like the 19th, and that would require renoticing everything, which I think is cumbersome, or kicking it over to full board, or kicking it over to the final action in committee in April, first week of April, which again just delays, and for fairness to EDA and everybody else to move along. I thought that the best thing to do would be to have final action, but that was the nature of my email.
I believe we just need to rip the Band-Aid off and get this done. Let's do it for final action. I mean, we've talked and talked and talked it to death.
Yeah, I can support that. We've had 3 workshops over 2 months. This has been on our agendas. I'd be interested in any other discussion, but otherwise I would
second Dave's motion then. I think Dave made a motion. I'd second that.
We want to include item 5 also. I heard him say 7.
What's that?
You want to include
I can't hear you.
You want to include item 5, I believe.
Well, you have 5. This is to take new business that's going to put it on decision to be made tonight, not 5. You're going to be doing 5.
Okay.
So I want the EDA for final action. You got your conceptual initiatives, which we'll talk about, but for the actual action of the board, I think I'm doing this correct, am I? Gary?
Yeah. So you want to move the Economic Development Alliance funding to an action item under 7?
Yes, 7B, and then move 7B to 7C, because depending on where the board decides, that could have a discussion on what we're doing with that, because we do have the invoice from EDA that is on our agenda today.
Okay. Everybody follow that then?
Close enough. Whatever Dave's motion was, I'll second it.
Close enough.
Okay. Basically, we're deciding what's listed as item 5 and item 7B. They'll be decided for final action tonight. I believe that's what we're saying.
Wait, are you saying the entirety of item 5?
Yes, it'll be for final action when we vote, make a motion.
Because I thought we were talking about 5A, whether or not to continue the relationship with the EDA.
Well, once we consider 5A, then we will be considering B, C, and D also, so unless we want to have a separate workshop. I'm sorry?
D doesn't need to be decided. That's something that we need to talk about. I mean, we need to take care of the EDA, but to...
I think he's already got it covered. In conceptual initiatives, you can talk about all this. My 7B will be for final action on our decision in regards to, so it's, I believe it's already covered. You can go through your entire 5A through D, and then we make the decision at 7B on the EDA.
Okay.
Well, I don't agree with putting them all together, primarily because I spoke with Andy Northrup this morning, who indicated he has no interest in entering a contract with the county right now. So it would be odd to initiate a contract with Andy Northrup when he has no interest in doing that right now.
The contract isn't with Andy Northrup, and I've spoken with him several times. The contract would be with MSU Extension for an educator position, as we discussed at earlier meetings.
Right, and that's exactly what I talked to Andy Northrup about just about 2 hours ago, as a matter of fact, and he indicated that he has no interest in moving forward in such a way at this time.
Yeah, his interest in this is irrelevant because this is a separate educator position with MSU Extension.
I think these items definitely need to be severed because we've been having workshops that talk about whether or not and to what extent to continue the relationship with the current EDA, not whether or not to replace the current EDA, rashly and expeditiously hire some new person at a cost of $120,000 who's indicated they have no designs on filling the shoes of the EDA, and creating a whole nother layer of government to do so. Those issues are a separate decision, and they need to be severed,
They will be
as they are in your agenda.
They will be treated as separate motions. Yes.
If I could, to me, it wouldn't hurt to have B, C, and D moved, down the road to look at. I mean, if we decide to reallocate funds from the EDA, we can address these other issues aren't immediate. We can have further discussion, as Dave says, or as Carrie says, on some of these other issues. I don't see those as being immediate, need. I'd like to address all of them at some point, you know what I'm saying? But in order to give people the time to look at it, if they want to handle A and decide, are we going to continue this relationship as it is, or are we going to reallocate in a different fashion? And then whether we're going to earmark that money for EDA throughout the county, whether we're going to engage MSU or some other entity, for purposes of fulfilling those things. I mean, I think those could be done. We'd have some time to do that. I don't know that we need to do it for final action. See, we could.
Well, then we can move them to the April 6th meeting. I would go with that.
Would that be more to your liking, Carrie, or?
That gives us 4 weeks.
Yeah, I mean,
In other words, address item A, so that the
Tonight.
EDA knows what we're doing, and we kind of know the direction we're doing, and then we can address it further for final action on the first committee
April
meeting in
6th
April.
committee. I would go for that.
Would that be acceptable?
That's certainly better than trying to lump them all in with the.
Okay.
You looking to, because I made the motion to amend the agenda, you looking to remove B, C, and D for tonight?
We will approve, if we approve those, it will be for final action on the April 6th committee meeting.
The motion would be amended to move those to the April 6th meeting for
Yes.
final action.
Right, for those 3
Addressing
items.
only
Can I have a
item A.
second? The way that I
Yeah.
see it, A, B, and C kind of all go together. And D is the only issue that's separate from the EDA. That's the only one that speaks about the MSU extension. Everything else is the EDA.
That's the way
It's
I
kind of
just-
what we're doing. So A, B, and C is kind of what we need. to
Conceptually, I
address.
think they do, but we can do it either way. It's just however you guys want to do it.
Yeah, I have no problem moving the MSU portion to the April 6th meeting for final action, and we'll take the other 3 on tonight.
I wouldn't support it for final action. I definitely think we need to look at it. We just talked about not having things rushed and put, if we're going to invest $120,000 into potentially an employee, and we're trying to ramrod it in the next 4 weeks. We just spent months talking about the EDA and what we're going to do with it. The plan there was to talk about the EDA and how we're going to move forward. It wasn't to push MSU or to push another entity forward. So I've looked at the EDA and spent all my time looking at the EDA and how it affects the county, not looking for solutions negating the EDA. So we can look at it, but I wouldn't want it for final action in April.
Which part of that, Lisa? Which?
The MSU item D that he wanted for final action.
In April.
Yeah,
In
you
April.
realize the final action is that we initiate a contractual document that then would have to be approved by the board. So this is just getting the process started.
I've got some huge questions about
I
MSU.
understand that.
Because they're already pro-solar, they've got NDAs all over their campus, and we're getting rid of one because of NDAs, and now we're getting into bed one that's pro-solar, has solar on their website, has farmers sign up on a website at MSU for solar. I just think we're getting in bed with a whole bunch more of this academia, and I'm not comfortable with academia.
Let me ask our parliamentarian, technically, Gary, you're the parliamentarian, how would you see this fitting out? Would it be better to do A and B now and the others later, or A and D later? If you don't mind me asking.
I think the issue in the queue is because Commissioner Rushing can't be here in 2 weeks, was to get the issue decided of funding the EDA anymore, or not.
And that alone.
Yeah, that alone, and that's A and B. So the funding is 2 parts, money and services. So I would vote on A and B tonight and let the rest go and, study it and in due course, then deal with it.
Okay, that makes sense, that we do have time, and Commissioner Vanderbush, I appreciate your thoughts on MSU. This was intended, and Commissioner Angie and Beeden, this was intended to open up the discussion, which we're already doing tonight. So I hear you that we need to do a little bit more thorough investigation before we go that way. So let's just consider A, B, C, and we'll take D out of there for tonight.
Procedurally, Dave, are you good with that on your motion? You'll
I'm
amend-
pretty good with that, but again, I'm good with A, B, and C, but to set that aside, we can do that also.
Procedurally, what I'm trying to establish here is the motion is going to be on A and B. I'll second
Correct.
the amendment you're making,
Correct.
your motion. That sets the stage for the motion, I think, doesn't it, Gary? Or-
It does.
Okay, so now we can,
Can we do A, B, and C? Because my concern is if we don't at least set that money aside, it may not be there.
Carrie's not going to run off and spend it. Promise?
She's not, promise?
If I may, the money stays in that line item. It doesn't get reallocated until the board reallocates it. So it's unnecessary to make a motion for it to stay there because it does stay there until the board makes a motion to put it elsewhere.
Okay.
So I move to amend the agenda to remove items C and D.
At this point, we're talking about final action on A and B and taking no action on C and D, right?
Correct.
Yeah, that's what the motion was.
So
His motion.
Correct. Yeah, and I'll put that, because I'm making the motion to amend the initial agenda. I'll add you
we've
what you just
essentially
stated.
done that, Carrie. I think we've essentially done that.
That C and D on conceptual initiatives be removed, and 5A and B will be considered under final action at 7B. And that's my motion, if that's correct.
Seconded that?
I would, that's
Okay,
fine.
So you already did, so you need to vote on that.
Can you restate that now?
Well, let's have our parliamentarian restate it.
Area.
So what he said is that items 5A and B would be moved to under new business, so I guess they would become, let's see, C and D, and they would be acted on for final action, that being to terminate the funding of the EDA and terminate any county services to the EDA.
Okay, very good. It's a mouthful. All right, we have a motion. We have a second.
I'd like a roll call on that,
I would too, please.
Wait, so you got to vote first on amending the agenda, and then you got to work your way down through the agenda to get to those items.
Okay. Do I have a motion on amending the agenda as so stated?
We already got the motion
Yep.
All
All
right.
right, motion, we have a
to
second.
amend it.
Okay.
Commissioner Angie,
Yes.
Commissioner Beeden,
Yes.
Commissioner Trello,
Yes.
Commissioner Samasco,
yes.
Commissioner Rushing,
Yes.
Commissioner Vandenbosch.
Yes.
Commissioner Felix.
Yes. All right, I have citizens to be heard. Mary Conlon,
Do we
please.
need to approve the agenda
Yeah.
has changed?
No?
I'll make a motion to approve the amended agenda.
Second.
Okay, all in favor?
Aye.
Any opposed? All right, motion passed. Citizens to be heard. Mary Conlon, please.
I'll make this quick. I have two. One, I'd like to pray for our county. Kind of sad that I'm always last, but Steve says the last shall be first, so I guess I'll have to be okay with that. Father God, I just praise you and I thank you for this board. I thank you for this county. The most heaviest thing on my heart is Mrs. Weiss. I ask that you give this board wisdom and understanding how to honor her and her husband for the years served without opening a can of whoop. So, Father God, I know you're the God of wisdom, and I ask that you help this board on how to figure out how to honor Officer Weiss and Mrs. Weiss. Father, I thank you that you're looking over our county to protect it, and I thank you that you're giving us wisdom and understanding on how to lead this county. In Jesus' name, amen. I'd like to talk about the EDA and MSU. I guess my number one question is, instead of having MSU or EDA come to you and say, we want this money, what is our oversight? What are we looking for? What do we want from, whether it's EDA or MSU? We're a farming community. We should be a tourist community, and we're not. We're losing millions and millions of dollars in tourism. And yet, we're trying to bring in solar, we're trying to bring in more manufacturing, more stuff that's really not healthy for our community. We have a beautiful community, and I think we're missing a huge opportunity. So before we decide whether it's MSU or anybody else, I think there needs to be a game plan of what we're looking for, whoever it is to come in and do what we want them to do. And I thank you for your time.
Thank you.
Mary, we normally don't go back and forth, but if you want to pray in the Human Services Committee, you be first. So just give me your slip. I'd love to have you pray over us first.
She was first to my committee too, so. All right, next, Sherry Shoecraft, please.
Good evening, Commissioners. My name is Sherry Shoecraft. Due to the necessity of brevity, I won't be able to fully convey everything I would like to say tonight. I have lived in St. Clair County most of my life. I attended elementary and high school in St. Clair. Because I loved this area so much, after returning from college, I built a home 6 miles from where I grew up. One of the things that has been most precious to me is the quality of life St. Clair County once offered its residents. The slow pace, the rural communities, the quaint historic waterfront towns, the tight-knit communities, and the feel of small-town life. Unfortunately, all of the things that I have loved about the quality of life here has been diminished at the hands of the EDA. Ironically, a link labeled Quality of Life found on the St. Clair County EDA's website offers an idyllic portrayal of what I and many others live here for. It says, "The St. Clair County lifestyle offers the best of all worlds, a community known for its tranquil small towns, pastoral charms, and drop-dead gorgeous water views." Are they joking? This is the same EDA that tried to drop a noisy data center next to a church in China Township. The same EDA that almost succeeded in bulldozing farms and destroying pastoral charms with the ill-fated 26-mile corridor project. As several township officials have testified during the recent EDA workshops, this is also the same EDA that is so ruthlessly pursuing development and bullying townships to accept the EDA's will. This is the same EDA that has been appending tranquil small towns such as St. Clair with the oversized Magna plant and the required infrastructure. Ask the people living in and around those areas about the effects of the extra traffic on their residential streets, or what they think of the tranquil small town atmosphere that the EDA has helped to destroy. Tranquil small towns and pastoral charms is clearly not what the EDA is supporting. They're supporting the agenda of builders and developers. They're supporting the agenda of those who stand to make a great deal of money from all of this development. We can draw conclusions from what we experience and see, because the reality is that the EDA hides behind a curtain of secrecy and offers no public accountability. We, the people of this county, have had enough. The last election ushered in a new era. It brought us a county board with the courage to confront the EDA monarchy. Tonight, I encourage the Board of Commissioners to vote to eliminate county funding of the St. Clair County EDA and to bring the community and economic development function in-house. Tranquil small towns and pastoral charms. Well, that sounds pretty good, doesn't it? We may not be able to reverse the damage that has been done to our community. However, we can preserve what is left. Thank you.
Thank you. Libby Prill, please.
Good evening. In a Facebook post, something that I saw earlier this week from an obvious EDA supporter, he stated that St. Clair County is dying, our population is aging, and if we don't do something to diversify our economy and bring new opportunities, new income streams, and new jobs to our county, it will eventually become a ghost town. As elected officials, they, meaning the county board, should know this. It is their duty to know this. Well, I think that this validates everything that we've been saying in the EDA workshops. I think that's the whole point. We've had 11 years of Dan Casey as EDA president, paired with 13 years of Jeff Baum as the chairman of the St. Clair County Board of Commissioners. And I think that they've created this problem and that they need to own the situation that this poster is describing. The poster also said that they find the county workshops laughable. Now, I think it's not laughable at all. I think it's quite serious. Actually, the first workshop was really completely dedicated to Dan Casey. He went on for an hour and 20 minutes trying to sell the features of the EDA. What we found out during that time is that part of the problem with the EDA is that, and what Dan Casey was defending, was the use of NDAs. The NDAs are a blanket secrecy agreement that has a clause that requires anyone that signs it to avoid any activity or outside interest which conflicts or appears to conflict with the best interest of the EDA. It isn't that the EDA will allow elected commissioners to sit on the board, and it's also laughable. Okay, what we really need to be concerned with is that the EDA will allow elected county commissioners to sit on their board only if they agree with that secrecy clause. The EDA Code of Ethics and secrecy agreement is widely available on Facebook. And you should notice that the secrecy agreement is not specific to any one business or any one particular deal or company, but it is blanket and it encompasses all activity. I don't think that that's safe for the community. The workshop discussions and board meetings allow the workshop discussions and board meetings allows the participation of the public. We can come and participate in that. Our meetings are live streamed and they're recorded and they remain available on the St. Clair County website. So if you ever want to go back and take a look at it, you can. The problem with the EDA is that we can't participate. Everything's done in secrecy. None of the meetings are publicly streamed. And our elected officials can only attend those meetings if they swear to the secrecy about everything that they hear, and they cannot report anything to the public. We have trusted this EDA to do the right thing in secrecy.
You got to wrap it up, please.
Okay. In secrecy behind a curtain as they determine the shape of our county. We can't do that.
Got to be it.
Thank you. We can't do that anymore. Thank you.
Thank you, Libby. I have no other citizens to be heard. Under updates, I had Andy Northrup slated to speak. He was very enthusiastic a few weeks ago. He then told me that given the current situation between the board and the EDA, that he was holding off speaking. So whatever happened there has happened. Okay, conceptual initiatives, we are moving that. So old business, I have none. New business, I have the TEI Condominium Association appointments, St. Clair member, representative, and board of directors.
Make motions on that full board.
Do I have a second?
Support.
Discussion.
Second.
Okay, hearing none. Can I have a vote, please? I hear it's sound off. All in favor?
Aye.
Any opposed? Okay, motion carries. 7B, I-69 corridor.
I moved that to 7B because the I-69 corridor may depend on what we do with your 5A and 5B.
Okay, all right, thank you. We're sifting through it here.
Yeah.
All right, I make a motion that the BOC suspend any funding of the Economic Development Alliance of St. Clair County and suspend any in-kind services indefinitely. May I have a second?
Second.
Discussion.
This is for final action.
Final action.
Your final action, thank you, Dave. Any discussion?
I have a little bit. We received a letter, I think it was 2 letters ago, maybe 3, from which you requested, and there was a couple of letters of agreement or memorandum that we could potentially look at. We received a letter back that it could potentially be negotiated, but the EDA decided that they could not adhere to the request that was given to them, that was sent back to us. And they're deciding not to continue with the county with what we requested from them. So I want to make that point clear. And that's another reason not to continue, because they do not want to even consider the items that we have there, and they would negotiate with it. But to me, This is a lot of money that the county does, $300,000 and in kind, possibly up to $400,000. I have 6 townships that I represent. 5 have resolutions. They do not support the EDA. IRA does, of course, and they have a contract with EDA, and they've made that decision as a municipality. I believe there's 9 municipalities total. So, and in the letter that was also sent from EDA, that they will be representing those 9 communities. The others can be represented by them if they get in a contractual agreement with them to get their services. Well, the entirety of the funds that have been dedicated to EDA, that covers the entire residents throughout St. Clair County, and I don't want to limit it to just 9 of them. So that was another reason I don't think we should go forward with this.
Thank you. Any other comments from commissioners? Steve?
You know, I've looked at this for a long time. I've been on the board initially. I was elected in 2007, and I've really tried to understand what the Economic Alliance of St. Clair County is, and I've spent more time recently because of the important nature of it. And I've communicated with Corporation Counsel on some things. I just want to put in perspective, you know, what is the EDA? The EDA is clearly not a Economic Development Corporation under the Michigan Economic Development Corporation Act, Act 338 of 1974. It is, in fact, by LARA filings, a nonprofit corporation under the Michigan General Corporation Act, Act 327 of 1931. Not unlike any other corporation with a purpose. It could be a yacht club, it could be the Alley Center, it could be anything. And they have a purpose and they pursue it. But they are definitely, and I've come to this in the last few weeks, just based on efforts researching some laws and looking at some filings at the county clerk's office. And in addition, in looking at LARA, for whatever reason, Economic Development Alliance of St. Clair County, entity number 822, oh, that's the old one, 800885851, is under the General Corporation Act, and they have another one, the Economic Development Alliance Foundation. It was incorporated in 1982, same name except for a little tweak on it, and it's under the Nonprofit Corporation Act, Act 162 of 1982. My point is, I always thought, and it's what bothered me, I guess, I always thought that the St. Clair County Economic Development Alliance was connected to St. Clair County in some fashion, you know, government as a government or quasi-government entity. I was confused on it, but it is not. So, and I think I owe an apology to Lisa Beeden because a while back she put some money towards a NGO, non-governmental organization. I said, I'm not voting for that because we're giving money to a non-governmental organization, not governed by a board with elected officials. I'm not going to do that. But yet we've done this for 14, 20 years, hundreds of thousands of dollars, and it's the exact same thing. It's a non-governmental organization receiving public money with no oversight by elected officials. And the really surprising thing for me, and I sent it to you guys, is in the bowels of the courthouse, in the back of the clerk's office, prior to 1999, when they started scanning and filing things, there's Resolution 83-7, which isn't even on the website. I happened to get with our county clerk to say, do we have anything under this Act 338 of 1974, which is the Michigan Economic Development Corporation Act. So you get a CDC, that gets you plugged into some of these other economic statutes. And sure enough, she found it. I'm sitting there with her, and she pulls it up. And then I actually spent quite a bit of time going through the boxes of resolutions from 1978 all the way to 1999 when they're on the website. So Ordinance 78-1, I misspoke. But Ordinance 78-1 is an ordinance by this board establishing the Economic Development Corporation of St. Clair County. And it's actually still viable. And there were things that corporation did as recent as 1983. I ran out of time at the clerk's office. They were closing the door, so there's a few more years I have to look at in the boxes. But the harbor down in Elginak, there's all kinds of things, and they use that for economic development for all these purposes. But yet, somewhere along the line, somebody decided to take an old corporation and it's called the Port Huron St. Clair County Industrial Development Corporation. It got the name changed to the Industrial Development Corporation of Port Huron and Marysville in 1980. Then in 1999, Economic Development Alliance of St. Clair County, a general business corporation under the statutes of the state of Michigan, not associated with a economic development corporation proper under this other act. It's like anything else, like a harbor club, it's like a whatever it is. So that's why I think the people were right. It is a club of sorts. It's people gathered together for a purpose, aggressive economic development for the purpose of their needs and desires with little or no regard or responsibility to the public at large. And that, to me, is the nut of the problem. So I'm going to vote to discontinue that funding because I want to be consistent. And I know we do some of that. And there's some non-governmental entities get some money. I think one was the, I forget the name, but we've done it for years. One of the organizations we support as a county, when they do contributions from the employees. But my point is, I just don't think it's good. I can't do it as an elected public official to continue giving that kind of money to an NGO. And whether we go in a different route, find some other place to do that, whether we dust off the St. Clair County Economic Development Corporation of St. Clair County, which is a viable organization, and use that as a method to access other economic benefits, we'll have to sort through that. But it's, in my opinion, totally inappropriate to continue funding a non-governmental organization, especially when they tell you we are not going to be transparent, we are not going to be accountable, we are not going to allow public participation. That's insult on injury. And that's just the way I got to do it. So that's my 2 cents worth. The other things we can look at later, but I've shared all that with you. I've shared it with corporate counsel. And Gary was kind enough today to respond and tell me that it looks like that's, unless it's been rescinded or revoked, it would be a viable corporation. And so far, I've gone through about 80% of the old documents and everything online. I don't see anything. It's kind of forgotten. It just kind of not being used. So I think it is viable, but even if it isn't, it could be revived. And if you look at the articles of incorporation for that entity, it has every piece of public accountability you would want, including designation by the board chair of this commission for persons from every district to participate, accountability, they're a public body. It's got everything that the public's complaining about, everything that I'd like to see happen. And I wish EDA well in the sense that they can have a lawful purpose, pursue what they want, but don't get mad at us because we can't just give you public money without accountability. So that's where I'm at on it.
Thank you, Commissioner Samasco. Any other comments from commissioners? I have a few comments. Just so it's clear before this board takes a vote, Dan Casey forwarded the EDA Executive Board's response letter to the commissioners, and I want to thank him for doing so. I have a few issues of concern in this response letter from the EDA Executive Board. He stated the county will receive additional board seats on the EDA Board of Directors, subject to each individual signing EDA's Code of Ethics and Confidentiality Agreement. To me, that makes that worthless. Any commissioner that sits on that board, you would render your position useless, so you'd be incapable of reporting on the effective use of public tax money. And then the second item I had a concern with, however, the EDA board believes that the proposed terms of the Memorandum of Understanding will render our efforts ineffective, and therefore we cannot in good conscience accept funding under those terms. By the EDA Executive Board stating that they cannot in good conscience accept funding under those terms, which is the public demanding transparency, they are indicating the EDA is ready to walk away from county funding. As county commissioner, I cannot in good conscience attend their board meetings while being forced to remain silent to the public I am sworn to represent, and I cannot in good conscience provide taxpayer funding to the EDA under the terms that they require for the way they choose to do business. I believe that per their response, they have already parted ways with us. I want to elaborate a little bit on what Steve said. Ordinance 78-1 that wise commissioners, much before us, came up with and organizing an economic development unit in our government. One of the parts of it says, Article 7, the board of directors of the corporation, and that'd be the EDA, shall consist of not less than 15 persons, one to be selected from each county commissioner district. The chairman and any member of the county board can serve. And it goes on further to say, the corporation shall notify the chairman of the county board of commissioners in writing of the corporation's intent to commence preparation of a project plan, and there shall be appointed promptly after such notice 2 additional directors of the corporation who shall be representative of the neighborhood residents likely to be affected by each project proposed by the corporation. In other words, back in 78-1, previous commissioners had it right. I can only apologize to the public for it taking this long to come to light. Any other comments? Okay, I would like to call for a roll call vote on this, please. And again, the motion is to the BOC, Board of Commissioners, suspend any funding of the Economic Development Alliance of St. Clair County, as well as their use of any in-kind services indefinitely, and this is for final action. A roll call vote, please.
Commissioner Angie?
Yes.
Commissioner Beeden?
Yes.
Commissioner Trello?
Yes.
Commissioner Samasco?
Yes.
Commissioner Rushing?
Yes.
Commissioner Vanden Bosch?
Yes.
Commissioner Felix?
Yes. Thank you. Second motion, if I can get a motion, I'm sorry, that the BOC limit any in-county services to the Economic Development Alliance of St. Clair County to what is statutorily required. Can I have a motion on that?
I'm not going to make the motion because I don't think it's necessary. There are no statutory items. I'll make the motion, but I'm going to have a comment about it. I'll
Okay.
so move.
All right, is there a second on that?
I second anything. I might not agree with it, but I think everything we do should be voted on and each one of us held accountable, so I'll second that.
Okay, let's have the discussion. Must be something I don't know.
Well, I have determined, at least in my limited legal understanding, that the Economic Development Alliance of St. Clair County is a general Michigan business corporation. I don't know of any particular statutory obligation we have to support or consider any effort on their behalf. So to me, I don't know. Gary, I mean, is there something, I don't mind doing it because it's like a nothing burger. It's like, but I don't see where it's really necessary or accomplishes anything. If you want to opine on that?
You're right. Once the funding is over, it's gone. There's nothing the county would provide to them or would be required to.
By statute especially, we have to, so.
Okay, then with that, I'll withdraw the motion if you withdraw your
Well,
second.
he has to
I'm sorry.
withdraw it, and then I would
Go
have.
ahead.
No, that's fine, no, that's fine. You can, I
Give me a
approve.
break. It's
I would
getting
approve to
late.
withdraw the motion, that's fine.
I'll withdraw my second.
Okay. Moving on. I-69 corridor, Next Michigan Development Corporation, 2025 membership fees. Do I have a motion on that item? Pay those fees.
So moved.
To send a full board, motion to send a full.
Yeah.
Support?
I didn't make the motion, that's your motion.
I did.
Commissioner Angie did.
Yeah, they're ahead of us here. Okay, discussion?
Quite a bit. I did forward to Carrie Hefting to get with you that we do have that invoice, I believe it's $6,500 to forward to the full board for the I-69 Corporation. And if we're eliminating our association with the current EDA, I asked what would be the time frame for us to get out of here. So I imagine that we have to approve some of this. Would this be, because this is an annual bill, would that be over a time frame? What actions do we have to take to withdraw from the I-69? Because if we do this, they're still going to be representing us, correct?
Yeah, I would say a couple things. I think we have an agreement with them
Yes.
where we have to give them like 6 months or a year's notice or something. The other thing is, on this one, I would kind of tread lightly. The county needed them for that Magna project to ever happen. And I tell you, it was, and I went over there for more than one meeting, and other people here did and whatever, and I thought there were times when it wasn't going to pass. And really what you heard was, well, we've been sitting here for 3 years waiting for a project, and who gets it? St. Clair County, and they're sitting over in Genesee, and they said, what do we get? Nothing, and they've still got nothing. And we're going to need support for them and continued votes to get all of our money paid back, to get St. Clair paid back, and I just, they did a good turn for us to get, $800 million project, and I would tread lightly on that. It's a minor amount of money, and I would not want to lose their support.
Is there a reason why the invoice comes from EDA? Because this is the I-69 Corporation. Why is the invoice coming from the EDA in St. Clair?
From a general business corporation.
I have no idea. I would just ask them to invoice you directly, the I-69.
I'd rather do that and support that.
We can get that done.
I sat on this board in 2011 when we entered into the agreement with the I-69 International Corridor, Next Michigan Development Corporation. And a fellow I came to know, Jerry Frent, died in the chair with that fellow sitting there with the purple shirt. And it was on discussion.
I remember.
It was on discussion of that topic. People were so fired up about what that meant, because that agreement allows Genesee, Shiawassee, Lapeer, St. Clair County to engage in what's called an interlocal agreement under Act 7 of 1967, or the Interlocal Agreement Act. And in the material on the agenda shows that there were 5 yeses and 2 nos. And guess who the 2 nos were? It was Dave Rushing and Steve Samasco. And it always bothered me that that act allows this new entity to exercise any function that could be exercised by any of the municipalities. And I didn't like it, and I still don't like it. So I will vote against it. And Gary, and I'm not that sophisticated. I'm not an investor. I don't want to do a disservice to the community. But I do know under that act that even if you withdraw, because the statute has no provision for withdrawal, because I checked that. I said, how do you, so Dave asked me about it. It's not in the statute. It's actually in the agreement. There's a section, just as you said, 6-month notice to quit. But the statute does provide that if you do withdraw, every other provision you've done to that point has full force and effect of law. So all these loans and all the other stuff. And to give you an example, like, we loaned $700,000 to this corporation. And I'm just curious, remember that? What was that all about? Do we ever get it paid back?
Yeah, what that was all about is they don't have any money. And they had to hire bond counsel, they had to do engineering, they had to do a lot of things for us, but they didn't have the money to do it. And they said, well, your project can either go ahead and you can advance the money and we get paid out of tax capture, repaid with interest. And the board voted on all of those advances. Or they said, if you don't want to advance the money, we got nowhere to get it, so I guess your project will die.
Okay.
So we said, well, no, we don't want it to die. So that's how that happened.
Somehow this Michigan Strategic Fund is the entity that authorized the creation of 7 such entities within the state, one of which was the I-69 corridor.
The one we're in.
We're in, and it's the biggest one. There's 33 participants. The other ones are small. So you've got the Michigan Strategic Fund and the Next Michigan Development Corporation, which is the whole Pure Michigan thing, together on that. And I followed the things that happened in the county and what the public has been upset about with respect to this, what I called aberrant behavior that I was taken to task on, that this behavior of the EDA that caused the public to be so angry. But it's occurring in Shiawassee and it's occurring in Genesee way more than here, way bigger and way more. So when Mr. Casey writes, hey, we are going to continue doing business as they do statewide, it makes me shudder. That's the problem. They're doing it the same way they're doing it statewide. And it just bothers me that I'd like to find a way around it. I guess we can send it to full board, but I'd like to talk to somebody about, the nuances of that because it still bothers me.
One thing I should also mention, so everybody understands why it was done through them. So in order to for that project to be successful, there had to be significant water improvements. There was not enough water service in the city of St. Clair to service that plant. So what you can do is there's a LDFA, that's a local development finance authority that can capture taxes to repay for it or to pay for those improvements. The problem is the city of St. Clair had ended their LDFA. They terminated it. So they couldn't capture the taxes to do it, and they probably couldn't have captured enough anyways. By going through the next Michigan process, they had the authority by law to capture taxes to pay for those improvements to make the Magna deal happen. And in addition to that, it also allowed them to capture school tax. And local LDFAs can't capture school tax, so that's what, like 18 mills or something. And so it was a huge economic addition to get the debt repaid, so the taxes are being paid by Magna. So that was another benefit that really almost forced it to have to go through the next Michigan process, because otherwise there wouldn't have been enough money generated to pay for the water line improvements that needed to happen.
So that's water under the bridge. It was a good thing. It brought Magna. Howard Heidemann is the board representative by that agreement. I don't know we're supposed to have a presence on. Who's our presence on the board? Carrie, do you know who on
The chair makes that
I-69?
decision.
Who is? Me?
No.
Well, I don't know.
I believe Commissioner Felix is our representative now.
Is that one of the appointments that I made? To
Yes.
That was to the I-69 corridor project? Okay,
Yes.
good. So that replaces Howard. Okay. And
Nice to know.
how long do we have to pay that? Can we look at this and kind of get our head wrapped around it and see? Because if there's things, Gary, that really benefit the county, and we have somebody there that'll champion our interests, I guess I'm better with that. But how would you suggest we do that? Just pay the bill, or it seems, I know some cities pay $500, we pay $10,000. What's with that? I mean, how's that work, Carrie? What?
Well, we pay $6,500.
Okay. I think originally the contract said 10 originally.
I
But
think originally it was 10,000, so the participating municipalities pay a fee, and then the county paid the difference, is how it was set up.
And then that entity, that I-69 International Corridor Next Mission Development Corporation, is not connected to the St. Clair County Economic Development Alliance in any legal fashion. So that's a separate entity.
It was interesting, when this thing was going down, we were having incredible problems getting a quorum there to even vote.
I'll bet.
Because most of the people are over there, and they're going, why should we care about your deal? I mean, when do we get a deal? And we go, well, we don't really care about you, we care about St. Clair County.
There seems to be a lot going on with that organization. I mean,
I hope there is.
well, in Genesee and in Shiawassee especially, they've had some big things over there.
That's good, that's good to hear.
That's it. I think I mucked it up enough.
Any other discussion?
A little bit.
Dave?
The 700,000, what is the time frame to get that money back? Or the LDF, that agreement in there? And I believe it's going to be,
Paid through the tax capture, is that how that
Yes.
works, Gary?
Yeah, it is, yeah. I could find out what,
okay,
kind of
but
what.
even if we were choose to withdraw, we're still going to get the tax.
They're not going to stiff us, I mean.
It all stays in effect.
Okay, so I'm not concerned about that. So nothing's null and void, but I believe there's 30-plus municipalities, counties and townships and cities that are part of this corporation. In St. Clair County, I believe there's only 6, and 2 have withdrawn since it's been going. So for us to be part of something, and I think we're the largest county by land area. Plus, we got I-94, I-69, we have the deep sea water, we got the rail. So you had to have that, I believe, for this thing to even take place. I think the corporation can go forward as long as City of Port Huron, City of St. Clair, City of Marysville continue with it. That corporation doesn't need the county. Because for us to be part of that, you're saying that, well, you're going to be the representative on that board. How are we representing, like my townships, they all put resolutions. They did not support this back when I voted on this, and I voted no, and I think you changed the contract. I'm going from memory, because there's some wording in there, and you said, yeah, I can take care of that. And we got the contract changed a little bit back then, but I still couldn't support it for some of the reasons that Steve brought up. And if there are people sitting on that board, whoever the EDAs, the Lapeer, I don't know, but they can do NDAs that affect St. Clair County, I believe.
No. They can't commit St. Clair County to any kind of an NDA. As far as I know, they don't have any anyways. By the time it gets to them, everything's out there. Everything's on the table, everything's public.
But I'd still like it, I could easily support 6,500. It's just an annual fee, it's not that much, but I would like to have the motions, if you could, do the due diligence, so we can have this either on the committee next month and look at exiting. Sure.
Any other comments or discussions from commissioners?
Now that you know that you're on this board, I'd be interested in getting your feedback as to, your take on it. Attend a meeting, see if there is value there for us, if it is important for us to be in the meeting. It is, to Commissioner Rushing's point, it's 6,500. It's not going to break the bank. We've got 6 months notice to give anyway. So I think it gives you time to do your due diligence and report back to us on what you think the value is of it.
I appreciate that, Commissioner Beed, and I will give you some comments right now, in fact. Corporate Counsel, could we say that this I-69 Corridor Corporation assisted the Magna plant to the point where it may not have happened without this?
I think it's a virtual certainty. Without this, it would not have happened, because there wouldn't have been enough. Without the school tax, I don't know that it could have happened.
Okay, and as I look at that from the citizens' perspective, that enabled this to occur in a manner that the community itself would maybe not have been able to support.
Oh, I agree.
Okay, and if the community itself couldn't support it, does that say we now have something that maybe isn't a good fit for our community? And I think it's become fairly public. They're looking at 18 months of potential layoff and other things that aren't ideal. So my point is that, is this $6,500 leveraging us into areas that maybe the people don't want to go?
No, really all it is the mechanism we needed to get the Magna, have enough money to finance the water improvements and so on for the Magna plant. If the county withdraws and doesn't pay its dues, if it gives its notice and doesn't pay after that, the world's not going to end and the Magna plant's not going to go away. But it's a board decision. It's not what I would do, because when I needed you, you were there for me, even though a whole lot of your people didn't want to be there because they thought, when are we going to get a great deal? And so my personal way of doing business is, somebody who does something like that for me, I'm going to be loyal to them to the extent I can. But if you don't want to, you don't have to.
I got a question, Gary. So Gary, I looked at the statute, and the range of authority for that corporation is the boundaries of the municipalities. So Shiawassee, Genesee, Lapeer, any township and municipality. And my only real concern was, and you've said I shouldn't be concerned, you answered a question. My concern was that we'll have forces outside the county that would be exercising authority that affects the county. No. And you're saying not. So with that, I mean, if that's the law, and I truly respect your judgment. You're actually older than me, and you've been doing this a long time, So I do respect that. But that was my concern, and that's probably why I voted back in 2011. I'm not doing that, because they'll start doing things we're supposed to be doing.
Yeah, the only way they can do anything here is if we ask them to come here and help us.
Okay. So as to Dave's point, they can't do tax recaptures, they can't do LDFAs, they can't do any of this other stuff. It still comes through this board.
Yep.
Now, that's not really evident from the contract, it's not really evident from the statute, but.
It's the only way it can happen, I guarantee it.
All right, thank you.
Can they liaison with the economic organization that we just eliminated supplying funds
To
to?
tell you the truth, I don't think they liaison with almost anybody. It's a board, and they're the mechanism to approve projects like Magna, but that's about what they do, and it's hard, really hard to even get a quorum, because it just is.
Oh, go ahead.
We wouldn't have gotten the upgrades to St. Clair Township without having that program in, because we were having issues at the north end of St. Clair with both water and sewer and the upgrades there.
You're right on both points.
Because we're having a terrible time, because some of the infrastructure, when they built out St. Clair Township, wasn't sufficient enough. They were getting low pressure areas, and they're adding a pump station and a water tower, which the fire department desperately needed in the north end of the community.
And I believe that type of an organization, that interlocal agreement, that's how you get access to these state monies, basically. That gives you special consideration. If you have that tool, you can now get money from the Michigan Strategic Fund, next Michigan Development Corporation, the Michigan, what they call Economic Development Authority that gives all the tax breaks. That's how it all plugs in, I think.
Yeah, you're right, and the state kicked in, I can't remember the number, but I think it might have been $1 million for a water tower as well, to make it happen. So it's a lot of people pulled together to make it happen. It was a pretty big effort. It was pretty interesting to watch.
But there's really nothing to fear from that entity because we still have control.
As Commissioner Beeden says, I will be there to watch them. So any other comments on that? Okay. Oh, we want to have a vote on that?
That'd be good, Bob.
Okay, I'm catching up here. Okay, funding for the I-69 corridor, Next Michigan Development Corporation, 2025 membership fees in the amount of $6,500. Can I have a voice?
You already have a motion and a second.
Yeah.
You're sending it to full board.
Yeah, voice vote to send to full board. Okay, all in favor?
Aye.
Any opposed? Okay, motion pass.
Thanks, Gary.
Yeah, thank you. Other community and economic development matters. Anybody have anything under that category? Okay, I just have one thing. This board has shed some interesting comments on the MSU proposal, and I can see that we need to look more at that, but we have to continue pushing forward to build community and economic development in this community. We heard all the people in here at the beginning workshop talking about the benefit they got from the EDA, talking about the need for economic growth, community development. As chair of this committee, I'd like to see that continue. I urge every commissioner to reach out and see what type of mechanisms they would like to put into play. And I will do likewise and report back to the board on committee meetings, because it is important that we do something for our community. The existing system, it worked for some and left a lot of holes for others. So that's my comment on that.
I have a question related to that.
Please, go ahead.
And maybe, Carrie, you can help with it. We currently have a memorandum of understanding with Michigan State Extension.
Yes.
And so these services that are out there are already accessible to our community. We just don't have a designated employee we essentially pay to be the county liaison.
I believe that's correct. I believe a lot of these services are already available. A lot of the classes, we don't have a designated person. I do see that Carly is here, so she might be able to answer those questions, but I believe she answered those at the other workshop too, that many of these services are already available to us.
Okay.
Just to address Lisa's question, this bit with MSU came about from the new commissioner school. There was a fellow there named Trevor Keys who was it's of course Michigan State partners with educating all over the place where they have new commissioner education. And this Trevor Keys was the EDA from Tuscola County. They were a conglomerate of several counties. And it was interesting. I got talking to him. He was an employee of Michigan State University, but he worked and managed that EDA in Tuscola and some areas up there. When I started looking into that, so what you get, like with our current 4-H and extension, I'm a certified pesticide applicator. I get training through them for that. Hay forage classes, I do stuff like that. So those are things you can sign up for and do through Michigan State. But this extension educator is a PhD, a master's or PhD level individual who, when you bring that in, they've got a segment of their university efforts that's focused on community and economic development. They have a center, they have food preparation, all this stuff. So you get that dedicated individual at, I think, $57,000 for a base salary plus benefits that we pay for. But then when you plug into that, you do get, there's a broad, we'll have more information on it perhaps. It's a very deep and very wide sources that you can get, including data, including software, including analytics, it's like cost analysis, benefit analysis, all the things, that you might want to do if you're going to spend money on a project. And I've talked to some people up there, and then I turned what I had over to Bob. I said, look at this. You think it's good for something? And he went and did a bunch of stuff. So that's where that came from. Carly Kruger was saying she had talked to some stakeholders, and someone said, well, who's the stakeholder? I guess I was one of them, because I called her. She's our regional extension person in this whole district. And I asked her, how's this work? I was interested in it. I still am. 4-H has been a great benefit to me as a young person in 4-H, and my family's done,
I don't disagree. I think it's a great value. I'm just saying if someone today wanted support and we've severed ties with the EDA, they could reach out to MSU now and start down that path, that there are some things available. It might be more robust if we're paying for it, but we're not without anything in place.
And I did ask that question, and I'm not sure what the answer was. I'd let somebody else answer, but that's a good question for him to answer. And it seemed to me it was something like you get certain levels of basic access, but if you want to get real hands-on, dedicated, directional stuff.
Sure. Well, I would hope there'd be added benefits if we're going to pay for a service, right?
That's all I know about it.
Okay.
Yeah, and what I learned too, Lisa, I called some of the communities, mainly in northern Michigan, that are using this program. I actually called a few of these educators, similar to what we would hire, as well as the organizations that were using the educator. And the indications were very favorable. They talked about specifics that the individuals
You don't have to
did.
sell me on it. I just wanted to point out that people can access current services through MSU. The county already provides that.
Yeah, if they have the resources.
I don't have to be sold on anything tonight.
Okay, very good. If they have the
Roscommon just turned
resources-
it down.
If they have the resources and time to do that, Lisa, that's fine. Yes. it's
Roscommon went in and put for a 0.13 millage increase to help get more services, and their community said no.
Well, I'm glad to see there's an interest. I hope every commissioner pursues different ways of doing this.
Just one last comment. I was in Sandusky this morning, and Rob Hybor, who's the Indigent Defense Director, was actually interested in this EDA piece. He was asking about it, and he said, well, how do you expect, if you go with MSU, how do you expect one person to do the job of 8 people at EDA? Well, you don't just get one person. You get the entire university. You get the entire, all that horsepower. So that's,
That's scary, because I've seen some of their programs.
A lot of the
Some of
public,
us farm too.
a lot of the public would disagree. What we had was pretty
I'll come
scary.
spray your pumpkins for you. David.
Any other comments? Okay. Let's move on. For information only, EDA weekly summary for February, week 1, week 2. Is that which we?
Motion to receive and file.
Thank you.
Second.
Okay. Voice vote. All in favor?
Aye.
Aye. Any opposed? Okay. Item 10, receive and file packets. Can I get?
moved.
So moved. Second.
Support.
All in favor?
Aye.
Any opposed? Okay. Adjournment.
Motion to adjourn.
May I have a second?
Second.
All right. Thank you.
I'll see you guys.